policies, including the environment, health, education, and economic policy. Its mission is to conduct the research regarding the policy making for sustainable development, and its vision is to be a center of excellence that contributes to the socio-economic development of Pakistan. Next, please. Reducing industrially trans fatty acids in Pakistan is a currently hot program, and different organizations are working on it. Its objective is to increase the policy engagement and public awareness about the industrially produced trans fatty acids, as there are so many health risks that are connected with the trans fatty acids. And in this program, we want to encourage the food industry to reformulate the products to reduce or eliminate the ITFA in their products, or to reduce them to up to 2%. That is the standard WHO has recommended, and to advocate the policies and regulations to promote the ITFA reduction. High ITFA consumption is linked to the heart diseases, diabetes, obesity, just like the non-communicable diseases. And in our study findings, or WHO recommended levels should be 2%, as it will reduce the 15,000 deaths per year in Pakistan. This is the study by the FPRI. Next, please. Key activities of this program was to conduct a comprehensive review of ITFA levels and their health impacts, development of awareness campaigns for policymakers and the public, and they host the this program host the workshops and webinars for medical professionals and the food industry. The stakeholder engagement is also important, as if stakeholders will be satisfied, they will do the ITFA reduction in their products, and then it will be marketed and we can save our consumers. So identify and engage the stakeholders from the food industry, government, and the community. Implementation of a communication plan to share the information and collect the feedback, and then to monitor and evaluate the effectiveness of the stakeholders. The main objective of our training today is to target the healthcare providers, nutritionists, and academia professionals, aiming to deepen their understanding of ITFA impacts and equip them with the tools to advocate for healthier dietary choices in the communities and the institutions they influence. And I hope and the outcomes of this webinar will be that the people who are joining it or they are attending this webinar will gain a comprehensive understanding of ITFA issues, enhanced capabilities for public and patient education, and strategies for advocating for healthier food environments. So over to you, Yahya. Please start the webinar and introduce our next speaker.
Thank you so much, everyone, for joining us today. So we'll be moving on to the opening remarks, which will be presented by Mr. Saram Bukhari, the Government Relations Lead, Kargil, Pakistan. Over to you, sir, please.
Assalamu alaikum ji. Thank you, Dr. Tahira, for your wonderful presentation. It's always a pleasure to listen to your remarks and the great work that you're doing at the Islamabad Food Authority. I just wanted to thank STPI for continuing the momentum on these discussions. We had a session, I think, a couple of weeks ago, which is very well attended, and great discussions, great outcomes. I think we're making really good progress in terms of our advocacy work around creating awareness of why reducing TFA is important. I think we have industry people, we have university people, we have academia all present, and it's great to see the collaboration of everyone together. I also want to say on behalf of Kargil that we are very proud of the work that is being done by all stakeholders involved with this, and we are really behind the industry, the academia, and SDPI to make sure that we reach a level where it is beneficial for Pakistan. We're able to reduce, we're able to introduce regulation that mandates the industry to reduce industry-produced trans fatty acids. I am happy to be part of the discussions, And thank you, everyone. And hopefully we'll have a good discussion today. Thank you, Yaya. Over to you again.
Now, next presentation will be from the Yahya. Yahya, please give a brief introduction regarding the ITFA.
Thank you so much, ma'am. So basically today I'll be uh, just discussing some basic pointers regarding the TFA, general introduction, nothing more. So moving on. The origin of trans fatty acids. The trans fatty acids are naturally present in dairy and meat products of ruminant animals. They contribute to 2 to 8% of our total dietary intake. Apart from NTFA or the natural trans fatty acids, the major chunk of TFA is industrially produced trans fatty acids known as ITFA. They amount for 80 to 90% of our total dietary intake. These ITFAs or PHOs are created when monounsaturated fats such as vegetable oil are subjected to the process of hydrogenation, resulting in solid or semi-solid end product commonly known as ghee. The World Health Organization aims to regulate the consumption of this dietary trans fatty acid and bring it down to 2%. Here we, so as by definition, the trans fatty acids are unsaturated fatty acids that contains at least one non-conjugated double bond in trans configuration, resulting in straight shape. Here we can see the arrangement of hydrogen atoms on carbon chain identified as cis and trans. A slight redistribution of hydrogen atom can bring about significant changes on the health implications of the end product. So moving on to the classification of fats. Fats are classified into two major categories, saturated and unsaturated. The unsaturated are further classified into two types, monounsaturated fatty acids and polyunsaturated fatty acids. The polyunsaturated fatty acids are health-promoting essential fats, mostly comprising of omega-3 and omega-6 fatty acids. These fats are liquid at room temperature. The saturated fats are solid at room temperature, have high melting point, commonly preferred by our confectioners and bakers due to its unique grain properties, layering effect, texture, taste, and definitely prolonged shelf life. The trans fatty acids are normally synthesized by partially hydrogenation of monounsaturated fat that imparts similar characteristics of saturated fats, but are way more unhealthier. The trans fats are way more unhealthier. While sorting the preferences, unsaturated are most healthy, as highlighted in green. And then we have the saturated ones. They are acceptable, but the trans fatty acids or the partially hydrogenated oils are unacceptable, and they have diverse implications on health. So the trans fats are typically classified into two categories. We have conjugated trans fats and unconjugated trans fats. The conjugated trans fats are naturally occurring and have few potential health benefits. When we look at the structure of conjugated trans fats, they have multiple double bonds that are separated by a single carbon atom. They are produced by the fermentation of anaerobic bacteria inside the stomach of ruminant animals, for example, cows, sheep. The traces of NTFA are commonly present in meat and the dairy products. Some literature indicates the health benefits of natural trans fatty acids, such as reducing body fat. They improve our immune functions and offer protection against certain diseases. Health benefits are still under research, so results are not yet conclusive. Moving on to the unconjugated trans fatty acids. Structurally, the unconjugated trans fatty acids have a double bond separated by two or more carbon atoms. They are commonly found in industrially produced, partially hydrogenated oil, as the unconjugated are typically industrially produced, hence are associated with significant negative health effects, particularly cardiovascular diseases and all. Many research studies have been conducted that conclusively indicate that consumption of ITFA results in higher level of low density lipoprotein, as an increase in bad cholesterol, while lowering the high density lipoprotein, restricting the good cholesterol in the body. Other health implications include increased inflammation, insulin resistance, and various metabolic disorders. The main dietary sources of ITFA in Pakistan are margarine and bakery fats, banaspati ghee, sometimes in cooking oil as well, if not treated properly. Where can we find the PHO? The partially hydrogenated oil. They are mostly present in pastries, our bakery products, parathas, snacks, pastas, desserts, and most of the processed foods. They are also commonly found in street foods, such as we have samosas and all the deep fried products, basically. So moving on to the alternatives, as discussed, the alternatives approach can be adopted, such as direct use of saturated sources entirely is an effective solution to reduce ITFA intake, such as use of canola oil, soybean oil, olive oil, rapeseed oil. We can move to the saturated portion, saturated options such as palm oil fractions, coconut oil, and cocoa butter. The blending method can be effectively adopted by the industry, in which we can blend palm fractions with various vegetable oils commercially available for the production of ITFA-free vanaspati ghee. The direct blend of 60% palm stearin, 40% liquid vegetable oil produces the most acceptable low melting point vanaspati ghee. The other studies indicate that while 95% palm oil and 5% palm stearin can produce vanaspati ghee of 38-degree melting point, the product appears homogeneous and has a soft consistency on oil separation. Many industries internationally are working on innovative solution towards the reduction of ITFA. A few common names are ADM, Nova Lipids. They are effectively working towards lipid technology such as natural stable oils, lauric and palm fats, blended fats, enzyme interestification, shortening and margarine derivatives. Similarly, we have Bunge oils from USA and Canada, effectively regulating or bringing in technologies for effective regulation of ITFA. Lastly, we have Cargill specificity oils. The Cargill specificity oils offer a complete line of zero trans, high solubility oils, stable oils. These new generation oil deliver exceptional stability without hydrogenation. These oil provide superior flavor, unmatched and outstanding performance. Thank you.
Thank you so much, Yahya. It was a very comprehensive presentation. Is there any question someone have? I just want to ask, Yahya, ADM, Nova Lipids or Bunge oils you have mentioned in the presentation, are they applicable in Pakistan?
I don't think so. They are adopting new strategies to regulate the ITFA, but I don't think these solutions are applicable in Pakistan. The most we can hope for is opting for the unsaturated sources, or we can move to, yes, definitely.
Oh, thank you so much, Yahya. Now we are moving to our next presenter, that is Dr. Sarwar Malik, the consultant endocrinologist, CTA Hospital, Islamabad. Please, over to you, sir.
Thank you, Dr. Tahira, Yaya, and Madam Razia for arranging such a wonderful event and very pertinent and important topic. As the name of cholesterol, when we are hearing, we thought cholesterol tends to have a bad reputation, with its name linked to heart disease, stroke, and other types of cardiovascular diseases. As we all know, cholesterol and other lipids are necessary for humans and animals as water and air. So cholesterol is not always very bad. It is essential part of our diet. The main component of cholesterol to make cell membranes and other structures a kind of building blocks for body tissue. Certain glands use it to produce corticosteroids and hormones, especially in males and females, estrogen and testosterone production. The precursor for these is also leading to cortisol, cholesterol. If there is no cholesterol, the male and female identity is lost. So when it is bad, when it is more than the required amount, then it can lead to bad effects. If we talk about the non-communicable diseases, we all know non-communicable diseases. These are the diseases, they are mostly chronic. Once a person gets the non-communicable disease, most of the time, they have to live with their diseases throughout their life. They are usually non-infectious and they can't be transmitted from one person to another person. The common examples of hypertension, diabetes, ischemic heart disease, cancers, and degenerative diseases. Can you move to our next slide, please? So Yaya has discussed very briefly about the fats as well as trans fatty acids. We all know fats are greasy substances found in tissue of animals and some plants. And they are an important factor of macronutrients. They are very high, rich in energy providing. They provide 9 kilocalorie energy per gram, while the proteins and carbohydrate, they usually provide almost 4 to 4.5 kilocalories per gram. Next slide, please. As Yaya has discussed very nicely, when we classify fats, they are saturated and unsaturated fats. The unsaturated fats are bad as compared to the saturated fats. So we have to know about the saturated and unsaturated fats in details. Next slide, please. These are the same. Then we divide the unsaturated fats in monounsaturated fats, polyunsaturated fats. Then ultimately, there are hydrogenation leads to trans fats. Next slide, please. Next, as this has already been discussed. If we talk about what are the recommendations, how much amount of the fats we can use in our diet. The total fat content should not be more than 30%. Saturated fat should be less than 70 to 10% of our diet. And monounsaturated fat should be up to 10%. Polyunsaturated fat should be up to 20%. So these are the recommendations we have to keep an eye while we are eating something, that these recommendations should be in our mind. Next slide, please. So as I have discussed, there are so many benefits of the fats as well as it is harm. It is a concentrated calorie source. Fats, soluble vitamins, and many minerals are absorbed because of the fats. If a person has deficient fat, then there are deficiency of so many fat soluble vitamins, especially vitamin A, vitamin D, etc. And these also providing a cushioning to vital organs. You see, there are cushioning effects of the fats between the vital organs. If these fats are absent between these vital organs, then there is sliding and friction, which leads to damage to vital organs. So it is also very essential to provide cushioning effect for vital organs. At the same time, it provides insulation. If our skin has lost fat, then there is so much evaporation within hours, a person can be dehydrated, which can lead to lethal effects. So it is very important a person have normal fat distribution in the skin. At the same time, these fats are responsible for transportation of the so many things in the blood. And as discussed already, monounsaturated fat and polyunsaturated fats, they can reduce LDL cholesterol as well as increase LDL cholesterol. I will discuss with little bit detail in next slides regarding why LDL and HDL cholesterol are important. Next slide, please. If we talk about the fatty acids, they are organic acids. You can say they are the building blocks of the fats. They usually exist in three forms: phospholipid layers, and in the center there are mostly triglycerides, and these triglycerides are combined with sterol components. Next slide, please. This is already discussed by Yahya. Next slide. Next, please. So we have to know about the sources of the trans fats. They can be divided in natural trans fats as well artificially trans fats. As Yahya has discussed in details regarding the artificial sources, natural sources include beef and lamb. They contain 3 to 10%. If we talk about the chickens, they contain only 0 to 2%. If we talk about the dairy products, they contain natural trans fats 3 to 7% of the cases. Next slide, please. So why these trans fats are used by the industry? They are usually used for food preservations. If these trans fats are added in different foods, the shelf half-life, the foods will be increased. So most of the time, they are used as a food preservatives. And at the same time, they also increase the texture as well as the flavor to the food. So these are the two common uses of trans fats in the industries. Next slide, please. So if we talk about the research finding, there are lots of data they need us to discuss. In brief, WHO estimates that trans fats intake is responsible for up to 500,000 premature deaths annually due to coronary heart disease. It means ischemic heart disease or MI. That is one of the leading risk for these conditions is trans fats. Consumption of trans fats increases the risk of coronary heart disease deaths by 28%. And if we talk about overall mortality, they will lead to up to 34%. Next slide, please. So the health hazards in non-communicable diseases by trans fat include cardiovascular disease like ischemic heart disease, myocardial infarctions, strokes, diabetes mellitus, and cancer. These are the four more common NCDs, which almost leads to account for 90% of the NCDs. So trans fats can contribute to these NCDs. Next slide, please. How they affect the cardiovascular diseases? They increase LDL cholesterol. This LDL cholesterol is called as a bad cholesterol. The function of LDL cholesterol is to take the cholesterol from the liver to the blood and from the blood vessels to arterial walls where they are deposited, and at the same time they can cause inflammation of the arterial wall. These two factors lead to making atherosclerosis that ultimately leads to narrowing the arterial wall, and once they burst, they lead to heart attack or strokes. And same time, they decrease HDL cholesterol. HDL cholesterol is called or considered as a good cholesterol. The function of HDL cholesterol is to remove the bad cholesterol from the blood and as well as at the same time, they can remove cholesterol from the arterial walls back to the liver where their detoxification occurs. So these trans fats are major contributors for increasing LDL cholesterol and decreasing HDL cholesterol, which ultimately leads to heart attacks and strokes. Next slide, please. You can see if the amount of trans fat increases, the risk of cardiovascular diseases increases very much. You can see the risk can be increased up to 1.4 times. If we talk about the mono and polyunsaturated fats, they are consumed if within the recommended amount, they can reduce the risk of heart attack and strokes very significantly. If we talk about the mono saturated fats, if we take saturated fats according to the recommended amount, then there is no deleterious effects of the saturated fats on our health. Next slide, please. So how they contribute regarding diabetes? They increase insulin resistance. Insulin resistance means that the insulin is produced by a person, but it is not effective to disposal the glucose levels as it normally do in a normal individual. So there is increased need of insulin to do the same function, which ultimately leads to increased burden on the pancreas. So the pancreas exhaustion started. This ultimately leads to increased diabetes. At the same time, trans fats increase adiposity in all other cells as well as in the pancreas, which ultimately leads to diabetes. In the same time, they can also impair pancreatic function, the function of the pancreas to release the insulin level. Insulin, at the same time, they can produce the glucagon hormone. These two hormones are very important for carbohydrate metabolism. So there is a disproportionate increase in insulin and glucagon levels, which ultimately leads to production of diabetes. As we all know, currently 537 million people are living with diabetes, and 2021 almost 7 million people has been died because of diabetes and its complication. So there is also contribution of these trans fats to generation of diabetes and its complications. Next slide, please. You can see here a mean glucose excursions. If a person takes high fat and high protein levels, there is increased glucose excursions. The other person who eat low fat and low protein levels, there is a good glycemic control. So long-term effects of trans fats as well as high fats can impair the glucose levels, as we discussed in the previous slide. How they do? They increase insulin resistance, impaired pancreatic beta cell function, at the same time increase fat deposition in the pancreas and liver, which further increase insulin resistance and generation of type 2 diabetes. Next slide, please. If we talk about the cancers is one of the leading cause of death worldwide. How they contribute to cancers, these trans fatty acids, they increase oxidative stress, production of the free radicals, damage cellular components including DNA, damage leads to mutation and contribute to the cancer development, high risk for breast, prostate, colorectal cancers, although they can be cause for many other cancers, but high risk for breast, prostate, and colorectal cancers. And these are very common cancers worldwide. Next slide, please. You can see there is the odd ratio regarding breast cancer, colorectal cancer, and prostate cancer. You can see when the trans fatty acids are increased, the odds shift to right side. That means there is increased incidence or prevalence of these cancers if a person consumes high amount of trans fats in their diets. Next slide, please. If we talk about the global initiatives, eliminating industrially produced trans fatty acids from the food supply is one of the WHO's priority targets to control and prevent non-communicable diseases. Although a safe level of trans fatty acid consumption has never been defined, the WHO recommends that trans fatty acid intake should not exceed 1% of total energy intake. The maximum limit of trans fatty acids in food products recommended by European Union is not more than 2 grams per 100 grams of the fats. The USA regulation, USA FDA determined that the partially hydrogenated oils are not generally recommended as safe for health. Due to these considerations, we have to make awareness in our population. So which fats should they take and which fats should they avoid? This is the responsibility of not only the SDPIs as well as this is the responsibility to mobilize our all stakeholders. We have to start campaigns at the school levels. At the same time, we have to motivate or involve our policymakers so that we can do something for our population. To do this, we have to can achieve this by providing some laws that the food levels should mention how much trans fats are there. And we have to educate our population choosing healthier fats and cooking methods. Next slide, please. Thank you very much for your patience listening, as only 15 minutes has been allocated to me. So in 15 minutes, we can do this much amount of discussion. Thank you.
Thank you so much, sir. Moving on to the Q&A portion of the presentation, we have some questions for you. We have a question from a participant. The trans fatty acid fall under the polyunsaturated fats or monounsaturated fats? Can you answer this particular question?
Trans fatty acid, basically, trans fatty acids are product of unsaturated fats. And unsaturated fats contains both monounsaturated fats as well as polyunsaturated fats. When you have melt these fats, both of these, they can ultimately hydrogenated and converted into trans fats. So you can say both of these can be converted into trans fats.
Okay. Moving on to the next question, how trans fats have direct link with obesity?
Because when the trans fats, there is tendency when these fatty acids move in your blood vessels, these tissue can uptake them. There is tendency more for these. That ultimately leads to build up more and more fats in the body, which leads to obesity. And you can also see there are multiple preservative as well as texture and all these things has been made. So you can start if taking trans fatty acids content foods, you can consume more and more foods. That also leads to obesity.
Another question from our participant. Can you kindly explain the link of oxidative stresses with ITFA?
ITFA means?
Industrially trans fatty acids. The link between the oxidative stresses with the consumption of ITFA.
Because these are partially hydrogenated oils. Actually, they contain partially hydrogenated oils. When the consumption in increase, that leads to generation of free radicals, and these free radicals they can target any person's genetic material. Basically, genetic material is made up of DNA. And once there is a disturbance or any damage to genetic material, the cell growth is out of their control. So that ultimately leads to different type of cancers.
Okay, thank you, sir. Ma'am, do you have any questions, Dr. Tahira?
Yes, somebody has asked about the how much grams of trans fat is safe per day. Trans fat is 2% allowed and 1% of total daily intake is allowed. And the other one question is, why is VTF technology currently not functional as a leading reformulating strategy? I would like to answer it because trans fatty acid standards are made by the PSQCA last year, and in this year, current year, it will be published. Then we will implement or regulate this among the industries to adopt the VTF technology or the take the trans fatty acids level up to 2%. There is no other question. We can move to another presentation. Yeah, up to you.
May I ask Yaya?
Yes, please, ma'am.
Hello. Yeah, there is a question from Arslan Slim Chugtai for Dr. Sarwar. Thank you very much, Dr. Sarwar, sparing your time for this very important. I think you are the authority on that NCDs and being endocrinologist for the diabetes. So how could you relate triglycerides with the insulin resistance? Because it is my personal observation that usually the HDL and LDL ratio is normal, but raised triglyceride levels among the diabetic patients. Over to you, Dr. Sarwar. Thank you.
Thank you, madam, for this important question. Triglyceride is one of the common finding you can find in person with type 2 diabetes if they are not controlled, a person with obesity, a person with pre-diabetes. So these three are linked to each other. This is ultimately what is happening. There is increased tendency of triglyceride levels in these persons because insulin is responsible for fat mobilization, at the same time fat metabolism. The other thing is insulin is also responsible for protein metabolism as well as the carbohydrate metabolism. When the carbohydrate amount which we need is metabolized, so that is used for energy. If there is insulin resistance or relative deficiency of insulin, so carbohydrate cannot be enter in the cells as they need it. These extra amount of carbohydrates then ultimately converted into triglyceride. Mostly they are converted into VLDL, very low density lipoprotein. And this very low density lipoprotein contains 95% of the triglyceride. At the same time, some proteins are also, when they are not properly utilized or metabolized, they are also converted into VLDL. That ultimately leads to increased triglyceride levels in the body.
Thank you, Dr. Sarwar.
Thank you, madam.
Are there any other questions? Should I move on? Okay. Thank you so much, sir. We'll be moving to our next presentation. Over to you, Mr. Zubair Faisal Libaasi sir. Please elaborate us on the subject. Thank you.
Yeah, thank you very much. My part of presentation is actually exploring strategies for healthcare practitioners to influence policy and patient diets regarding ITFA consumption. So there are two components. My presentation has something to do with what other speakers have already spoken about. A couple of points I will make because these are relevant in a number of ways by means of reiteration and also slight correction somewhere. Next slide, please. So I will start what is TFA and what is ITFA. Here we are not making this distinction very clearly that what is TFA and what is ITFA. And what I will do is we will speak more about ITFAs. TFA is trans fatty acids. Next slide, please. So our area of concern is industrially produced trans fatty acids. This is not the ruminant animals, the sources of animal and plant kingdom. The source is that when you partially hydrogenate an oil and you give it a granular structure to look like a ghee, desi ghee, which we traditionally used to have. So this ghee actually is something which we desire to have as replacement of desi ghee. So we try to have this granular structure. So whenever we are talking about TFAs, we are talking about and the dangerous effects of trans fatty acids, we are talking about industrially produced trans fatty acids. This is my understanding, and this is what WHO actually recommends. And what they say is that any of the food should not have more than 2% of industrially produced trans fatty acids in it. So they are not talking about other sources. They are just talking about when you partially hydrogenate an oil, you give it a texture of a granular structure, then it becomes dangerous. Why it becomes dangerous, I will tell you in a couple of slides more. So we should have a very clear understanding that this is the industrially produced trans fatty acid. This is the most hazardous, and there is a consensus amongst the scientific community that this component, this toxic material, is causing cardiovascular diseases, endocrinal diseases, and every kind of disease which I will talk later, which is an ingredient of concern. Next slide, please. Next slide. Yeah. So if you look at the structure, what you see that the trans fat, which is in the green part of the slide, is that it looks like a brick structure, cemented structure, brick-like structure. And if you look at the left side, the unsaturated one, which is a bent structure. So if you allow me, I can give you an example of a cemented concrete-like structure, which is the trans fat, and sort of stones-like structure without having any cement in it. You just kick them and you can throw them away. So your body cleanses it. But if you have this trans fat, particularly industrially produced trans fats in vanaspati ghee and not in margarine, because margarines are products of oil, so they do not have more than 2% of industrially produced trans fatty acids. But if margarines get that partial hydrogenated oil going into that, then it can have. And bakery ware and fried street foods, they usually use granular structure, partially hydrogenated oils, and then we have these trans fats. So trans fats are the industrially produced trans fats are the most dangerous, and there is a consensus that these should be eliminated from the food supplies. So because this structure is like this, that it gets into your heart, into everywhere, wherever your body places it, it becomes a source of diseases and source of injuries within the body. One more point which I want to make here is that when you this technique which is called partial hydrogenation of oil, this technique has something to do with it. When you use another technique, which is called intersterification, it gives the granular structure, but it does not produce industrially produced trans fatty acids. So in Pakistan, what we require is to change the technique of production. And the other point is that this blending thing, which someone was saying that it is a solution. Blending is not a solution, because in blending you increase the amount of saturated fats, and saturated fats can also not be more than 10% of any fat in your food supplies. So you have to be very careful when you are suggesting these solutions. So blending is not a solution anywhere in the world. It is the elimination of partial hydrogenation. That is the solution. And partial hydrogenation process has another factor, that when you add an ingredient called nickel to quicken the process and to make this process happen, as a catalyst, you use nickel. Then nickel is not, it is added, but it cannot be taken away completely. So that the parts of nickel which stay within the within the ghee, vanaspati ghee, they become free radicals, and they can make compounds in your body, which creates all these kind of problems which Dr. Saab has already spoken about. So be very clear that this technique of production of ghee has something to do with it. Next slide, please. I will not go into details, just I will say that why industry uses it. Basically, these are all the taste and longevity of shelf life of products and texture. It has no health benefits at all, rather it is dangerous. Next slide, please. In Pakistan, if you look at this chart, Pakistan is the second country which is using these fats and trans fats as source of energy. And this is why Pakistan, after Egypt, Pakistan is the country which is using these ingredients in high quantity. Rather, Pakistanis are using 3 ingredients in high quantity, and this is why there is a widespread of non-communicable diseases. Number 1 is oils and fats. According to WHO, per person, consumption of oils and fats can be 4 to 5 kg per person per year. But in Pakistan, it is 25 to 30 kg per person per year. So this is when Pakistanis are using fats as source of energy, they are basically increasing disease burden in communities. The second ingredient which Pakistanis are using in high quantity, that is added sugars. They add sugar into everything, and that added sugar is causing all kinds of problems like diabetes and others, stroke, obesity, and everything. And the third ingredient which Pakistanis are using in high quantity, that is salt. So I will stop here and let's go to the next slide. It has so in main dietary sources of ITF in Pakistan, these are basically vanaspati ghee, some part of margarines, not all margarines, because margarines is a blend of oil, so it cannot have a lot of industrially produced trans fatty acids. And recent tests which were conducted at PCSIR, none of the margarines have more than 2% of ITFs in it. However, this vanaspati ghee, because it is used in bakery products, so there is a risk of having more the spread of this ITFs in all foods that are mentioned on the left side, and these are causing problems. So you have to, what the target is, if you really want to make correction, it is not by increasing awareness amongst the people about ITFs. It is basically having a very strict implementation of the regulation or the standard by PSQCA that no food should have more than 2% of industrially produced trans fatty acids. And if you stop this partial hydrogenation, then you will save this country from falling prey to non-communicable diseases, which is causing all kind of problem, including early deaths, disabilities, diseases, strain on resources, and your economy is going down. Next slide, please. So it has already been mentioned that what kind of problems it causes. Next slide, please. Yeah. So this is a chart. Actually, it gives you sort of an assessment that almost every part of human body gets a stress of industrially produced trans fatty acid whenever it enters your body, and plus the nickel that you actually ingest when you use this partially hydrogenated oil. So this is cancer, obesity, this is inflammatory profile, Alzheimer's disease, depression, and your endocrine system and reproductive system. It actually stressed out, and this is what we are witnessing in Pakistan in a number of cases. And so we have to be very careful about it. And Pakistan really requires very strong policy action, strong implementation of eliminating partially hydrogenated oil. Saudi Arabia has done it. Many other countries have done it. More than 60 countries have actually enforced this regulation of not no food should have more than 2%. It is not achieving 2%. It is no more than 2%. It is a limit. Next slide, please. So the best practice policy is eliminate industrially produced trans fats by banning partially hydrogenated oils. This is one of the best policy practice around the world. Many countries have done it, and there is a very significant, there is a statistically significant results that over a period of time, cardiovascular diseases are reduced in the population where this ban is put in place. It includes Denmark, it includes even Saudi Arabia. And then the second best policy is 2% limit of ITFs of total fats in anywhere in any of the food items. The next slide, please. So what advocacy is required? The one thing which I said that you require a policy change in Pakistan. The second one is consumption, and you influence consumption not by telling people not to consume. You influence consumption by various means, which includes your fiscal effort, which I will tell you later, and then collaborations. Next slide, please. I think you have most of the participants must have they must have been aware of this replace module of WHO. It actually gives you a very comprehensive, if you go to their website and search this, you will have a very comprehensive action framework that how a country should move towards replacing unhealthy oils and fats from their food consumption, including the oils which have high quantity of saturated fats. Saturated fats should not be more than 10% of your any of the food. Less than 2% industrially produced and 10% of the saturated fat. So you go to the website and see that review, promote, legislate, assess, create, and enforce. This Pakistan is legislative part. Pakistan has almost completed. Pakistan has identified 5 food items, which includes oils and fats, that they should not have more than 2% of industrially produced trans fatty acids in it. But enforcement part is lacking. And plus, industry is not being asked to comply with the standards which Pakistan has already created. And this is why Pakistan is being categorized into a partially complying country. It's not fully compliant. It's not the best practice country, which Pakistan should be. Once a regulation that all food should be ITFA free, then Pakistan will be the best policy country, and hopefully within 3 months' time it will happen. Next slide, please. So now what strategies a health profession can do? To my understanding, they cannot do much. They cannot really train every human being, and it is not possible. You have to really plug the source of ITFAs coming into the food supply. However, what is required is that our medical profession perhaps needs to have more on nutrition side. Our doctors are trained for certain type of diseases, which are well-funded, where we have well-funded research programs. So training of human resource in nutritional sciences and wellness is perhaps a very much important, and we have to review our medical curriculum that our doctors are trained in these disciplines and they are trained how to communicate as well. So this is one thing I think it is required. And then doctors must have access to a preferential access to WTO authenticated knowledge. I'm saying this again and again because there are lots of misconceptions, and there are lots of people who behave like health professionals. They come on YouTube, on social media, and they start selling their saturated fat products like someone was saying coconut oil is good. Coconut oil is not good. It is absolutely not good. It has a lot of quantity of saturated fats, so don't fall prey to that. Always try to access WHO authenticated knowledge, which is scientific and which is credible, and it comes off, to my understanding and my belief, that it comes from an objective analysis of the research going on around the world. It's not industry funded. So health profession can perhaps, the profession needs to look into that. Next slide, please. I'll just quickly wrap it up. I think in clinical settings, Pakistan really needs to deepen its screening facilities, that NCDs can be prevented. And there has to be a lot of emphasis on prevention of NCDs. As Dr. Sarwar has mentioned, that once you fall into the category of a patient of NCDs, there is a possibility that you will live your life with the disability, with the disease. So the best practice around the world is to save your population from NCDs, from cancers, from obesity, from hypertension by consuming less salt. And pre-diabetics can be reversed. So Pakistan needs to really deepen and have this facility of screening facilities at the basic healthcare units. Then information brochures about sources of ITFA in local languages perhaps can be given. Then display information and the warning signs can be displayed in clinics, which are usually done in the urban areas, but not in the rural areas. We need to have this. This geographical spread of this information has to be better. And then ask patients to see nutritional facts. This is perhaps very important. And I think Dr. Allah Rakha will speak about it, that how important it is that we should develop this habit of looking at nutritional facts. However, Pakistan also requires to upgrade its legislative framework to make sure that all packaged food has these nutritional facts in a certain manner. It's not that it is confusing. You have to tell that how much industrially produced trans fat is in the foods in the food item. Then help people identify items which may be harmful. This is, doctors can perhaps tell them, as we have seen in different presentations, that these items can be identified and spoken to the patients. Information, nutritional information about healthy food choices. This is perhaps when you tell your patients that not to eat, they always ask then what to eat. So healthy food choices, that you should cut on, you should not use beverages, you should not sweetened beverages, and you should not use added sugars, less salt, less fats, and less oils. This is all part of nutritional information which perhaps we need to give it to the patients. Next slide, please. I think doctors have a social function to play as well. It is not the clinic where doctors have to be. For doctors, perhaps every street, every place is what they influence. They influence by being one of the leading sort of epitome of knowledge. So I think doctors must spare some time, because this is the way they give back to their society. They conduct seminars. First, they must equip themselves with the right kind of knowledge, nutritional knowledge, and then conduct seminars in schools and colleges and universities. This must be a regular feature. What I have seen that in many developed countries, doctors volunteer. In Pakistan, perhaps it is not the practice. This can be encouraged. Then encourage educational facilities not to sell ultra-processed food. These ultra-processed food, or so-called frozen foods, these are usually the most suspect carriers of industry produced trans fatty acids, all pratas, frozen prata and everything you get, and you get them and get them tested at PCSIR, you will know the results. Then form a group of health professionals and contact with like-minded groups. Perhaps this group formation is very important to influence policy. And this is what we have actually done very successfully. We formed a group and we try to influence PSQCA's decision on this. And this has been one of the success stories in Pakistan. And you will see the results. And then I think doctors must attend seminars and workshops on ITFs like this one and other dietary risk factors. WHO conducts a lot of such seminars. They have a lot of material. FDA also has a lot of material, but I would recommend PAHO, 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 which is equivalent of WHO in the Latin America. And WHO websites, they give easy to understand information about dietary risk factors and global health policy agenda, and doctors must look into that. So next slide, please. Thank you very much. So nice of you.
Thank you so much, sir, for your time. The floor is now open for question. Sir, we have few questions from the participants. First of all, first question is, cheese is from ruminant source, then how its trans fat can be harmful? Can you elaborate, sir?
Sorry, if it is taken from the animal sources?
As cheese is from ruminant source, then how its trans fat can be harmful?
I think Dr. Sarwar has already elaborated on this, that if you consume a lot of fat, then you stress your endocrine system and your insulin resistance jumps in. So that is something which is very important to know. I think people must, because your insulin actually processes both proteins and fats. So this is somewhere there. So even saturated fats are harmful if they are taken in large quantities. If you even consume desi ghee or butter in large quantity, it will be harmful. So even butter should not be more than 10%. For example, if you're cooking your meal and you are using olive oil, so only 10% can be makhan or butter or desi ghee, and 90% should be the olive oil. So this is a ballpark figure which I can tell you. So the process of how they infect your body, how they damage your body, how they increase vulnerability, how they cause diseases, I think Dr. Sarwar has already said, and he can perhaps elaborate later as well.
Thank you, sir. Sir, we have another question. What are the regulatory bodies doing to control ITFA in Pakistan?
Yeah, thank you very much for asking this question. This is perhaps one of the most important questions for me, because health related, I'm not a health expert, so I would always refer to health professionals to answer these questions. So I just tossed it to Dr. Sarwar myself, rather than saying something which is incorrect. It is better. So this policy thing is something which I can talk about. Pakistan actually started back, WHO actually came in with this scientific evidence that industrially produced trans fatty acids are leading cause of the diseases, non-communicable diseases, which includes cardiovascular diseases, endocrine diseases, and stuff like that. So in 2018, WHO recommended to the member states that they should take steps, take measures, policy measures to regulate the food supply in the country. So to me, it is a problem of food governance. I look at it as the problem of food governance. Pakistan has serious deficiencies in that. And there are a number of issues that I can flag. But Pakistan definitely has problem with food system of food governance. One part of food governance is that Pakistan has a body called Pakistan Standards and Quality Control Authority. So Pakistan Standards and Quality Control Authority can generate an effect of regulation or governance by setting standards for foods. Like milk should have this much of solid particles or solid non-fats in it. They set standards for everything. They set standards, for example, a sugary drink should not have 5 grams of per 100 milliliter of a drink. So they set standards and they try to make food safe for general consumption. So this is the state of policy making in Pakistan, that you have Pakistan Standards and Quality Control Authority. They will set a standard which will have effect of regulation, and they will pass this standard notification to the food authorities like Islamabad Food Authority, Punjab Food Authority, Sindh Food Authority. And then food authorities have the capacity, resources, and mandate to implement that standard onto all foods wherever these standards have been created. For example, halal food and stuff like that. However, in Pakistan, there is a problem. Problem is that PSQCA also thinks that they have a mandate to inspect food, especially the packaged food. And now there's a slip between lip and the cup that food authorities and PSQCA have to talk to one another. There has to be an institution where they can talk to one another and create a Pakistan level standard or Pakistan level regulatory environment. And various food authorities have they are at various stages of their capacity to implement these laws as well. So in Pakistan, we are in WHO's language, we are partially compliant country because we are not using the best policy practice, which is banning PHO or having 2% limit on all foods. So these are two best policies. One, ban partial hydrogenation of oils. No factory, no mill should do this. Number two is that all foods should have less than 2% of ITFs. Pakistan, so far, where we stand right now, we should have done it by 2023, starting from 2018 till 2023. But Pakistan had missed the deadline, so we are vulnerable. And where we stand right now is that only 5 food items, but these are significant food groups which have actually been which are under this regulation of not more than 2% of ITFs in them. Bakery items, oil and fats, and ice creams and biscuits, and I think chocolates as well. I have the notification, but these are five major groups. So oil and fats are already mentioned. So no ghee or no vanaspati ghee in Pakistan, in theory, can have more than 2% in it. Now, problem is of implementation. And we are not really using all our resources to save our population, to have this kind of health security in Pakistan. So that is the problem. Thank you very much.
Sir, we have another question. Has our neighboring country, India, opted for ITFA standards? And if so, how were they able to achieve the target of 2% set by World Health Organization? Thank you.
Yeah, thank you very much. Actually, India is one of those countries who have this best practice policy that all foods should be ITFA free. In India, they had the luxury that India is a state which has actually created provinces. So their federation is something like that. The center has fragmented itself and created states. So the center has the power, all power reside with the center, and they can issue decree which is implementable in all states. So they have a special food authority, a special food governance arrangement, standard making arrangement for food, and they have legislated in a very concise manner that all foods should have less than 2% of ITFs, and this is being implemented in all over India. So India is fully compliant WHO member state. Pakistan, on the other hand, is a federation which has provinces, and these provinces came together to form Pakistan. So federation only uses those powers which have been given by the provinces to the center. And this food is a provincial subject. So what Pakistan requires is to reinterpret some parts of the constitution, because federal government can legislate about the weights and measures and stuff like that. So those weights and measures can perhaps, this prerogative of the federal government can be expanded. And these are all weights and measures, that how many milligrams of anything can be part of a food supply. So Pakistan needs to reinterpret some of the things. However, as we stand right now, is that this is not fully legal, but we have done it. That Council of Common Interest, at some point in time in 2020, they decided that PSQCA will decide about the standards, and all provinces will implement it, so that there is a harmonized standards in Pakistan. And I think for the time being, we can go ahead with it, and we can live with it. So India is a very good example of one regulation for whole of the country, and all foods should not have more than 2% of ITF. And we are in Pakistan using this PSQCA mechanism. We have also proposed, and during the last meeting of National Standards Committee, they have formed the technical committee, and technical committee have already recommended that this standard, mandatory standard, should be adopted within the PSQCA. For example, they have one standard that all food should be halal food. So this all food about ITFA can be implemented in Pakistan. And I think if we really go after it within 2-3 months, Pakistan will be fully compliant country in WTO sense, WHO sense. And I think all people who are listening here must write to PSQCA and to food authorities, and to even to the Prime Minister or the President, write a letter that Pakistan should also have less than 2% of ITFAs in all foods. So that must be the standard. Thank you very much.
Thank you, sir. Just 2 more questions. Our audience is very active today. Basically, how can government win the confidence of industry in this regard?
Actually, industry is not really, my hunch is, what my experience is, that industry is really not creating any barriers. Most of the industrial players, the big players, the 5 big oil and ghee manufacturers, they have already started complying with the ITFA standards. And you're looking at Cargill. Cargill is one of the proponents of ITFA-free oil and fats in Pakistan. So but rather I would say that this is the industry which is leading this awareness campaign. It's not the civil society groups. It's not the professional doctors and nutritionists who are leading this thing. This is the industry. Even if you look at on television channels, these are oil and ghee manufacturing firms which are talking about that industry produced trans fats should not be, their brand does not carry this. So in Pakistan, I think there's no actual resistance from the industry. However, the little guy, because they partially hydrogenate these oils, if you ask me that what should be the solution, what I would recommend is that government of Pakistan should make it easy for the industry to adopt new technologies, even because Pakistan is not a technology producing country. If circumstances allow, give our fiscal conditions allow, let firms and mills to import interesterification technology from other countries. Indonesia has gone interesterification. India is actually interesterification now. They are not using partial hydrogenation. Saudi Arabia is not using, and there is a list of countries who have actually stopped partial hydrogenation. So what industry requires is to transit from partial hydrogenation, and this is a smaller guy, not the big guy. All big brands, they are not carrying ITFAs, but these unknown sort of brand, Maize Banaspati or Tala Banaspati, they actually have higher levels of 16% or even 30% of industry produced trans fats in them, because they use this partial hydrogenation technology. So government should perhaps try to facilitate this technological transition. And this is where I think big industry players can somehow help out their smaller guys. And government of Pakistan can perhaps do that. But this is a question which requires some research, and we wanted to do it, but our project was actually scuttled by someone. Maybe at some point in time we will do that. Thank you.
Sir, last question. As ITFA produced by partially hydrogenation, then why we don't go for the esterification process to reduce the risk? What are the limitations that still we are unable to offer the esterification process? Thank you.
The technology is expensive actually, because our smaller guys, they have technology which they got secondhand when Europe was actually phasing it out, because in their countries legislation and regulation was already in place. They had identified that industry produced trans fatty acids are not good for the health of the population. And Pakistani entrepreneurs, they bought that technology and they started doing it in Pakistan. So this is where we stand. I think interesterification is expensive, and this is why I said that smaller guy needs some hand holding. They require some investment, some concessional loans, possibly some industrial policy from the government of Pakistan. Maybe like if I have to assess them, maybe I create a special window of funds which are on low markup, but well guarded, that industry can get loans and they shift their technology. This is one of the solutions which comes to my mind. And possibly government of Pakistan can waive some duty off the machinery which is required for interesterification, and also help train Pakistani workforce to manage that machinery. So that is basically industrial policy argument. So there are some impediments, or some, rather I would say, omissions. Government of Pakistan is not taking action. So and as a less developed economy, our business enterprises are not the smaller guys are not really rich in the sense that they can access, they can halt their production system and they start importing new machinery of interesterification. So this is somewhere the problem is. So I think some fiscal support, some technological understanding, some awareness, and some penal action by the food authorities can make a difference. Yeah.
Thank you so much, sir, for elaborating on the subject, and we'll be moving on to the next portion of the presentation. Thank you. Thank you very much, sir. I would like to invite Dr. Allah Rakha from University of Agriculture, Faisalabad. Sir, please, the floor is yours.
Thank you. Thank you very much, Yahya sir. Thank you very much to all the distinguished panelists. Sorry if there is disruption in my voice. I don't know. You can hear me, Yahya sir?
Loud and clear, sir. Please go ahead.
Okay. Okay. Thank you very much. Thank you very much. Thank you very much. So the topic that I am going to talk about is significance of reading labels, a role or perspective of teaching institutions. So my name is Dr. Allah Rakha. I am Associate Professor at National Institute of Food Science and Technology, University of Agriculture, Faisalabad. So along with my affiliation with National Institute of Food Science and Technology, I need to introduce my other organization, that is Pak Korea Nutrition Center, where I am leading this component of policy, advocacy, and outreach. We have sort of specific section dedicated to address policy, advocacy, and outreach issues. As some of the recommendations that Zubair Saab has given, that the nutrition institutes, they must arrange seminars. Sir, to your information, we are sort of leading institution in nutrition. We were the pioneer to start a degree in human nutrition and dietetics, and we have very strong collaboration with Faisalabad Medical University. Apart from degrees, we often arrange seminars, conferences, and sort of dialogues also. And we will invite you also, sir, in some of our future activities. So next, please. So the topic that I am going to talk is very important. Very important, not only from consumer perspective, consumer point of view, but also from regulatory bodies and enforcement bodies. They really need to come up with the solutions or to regulate this food labeling, because this is something where the food industries are trying to play. Sometimes they sort of label falsely to mislead the consumer. So food labeling is very important aspect, जिसकी बेस पे कोई भी कंज्यूमर जो है वो ये फैसला करता है कि उसने कौन सी प्रोडक्ट लेनी है। क्यों? कि वो लेबलिंग इतनी अट्रैक्टिव होती है जिसकी वजह से कंज्यूमर के लिए चॉइस जो है वो थोड़ा सा इजी हो जाता है। सो लेबलिंग बड़ा इन्फ्लुएंस करती है कि वो क्या चीज खरीद रहा है। ठीक है, ये हमें अंडरस्टैंड करती है कि फूड के अंदर क्या है। ठीक है, क्या चीज हम खरीद रहे हैं, उसके इंग्रेडिएंट क्या है, ये तमाम चीजें आपको फूड लेबल्स के थ्रू पता चलती है। नेक्स्ट प्लीज। सो जो लेबलिंग है वो करते कैसे हैं? हम सब ने देखा होगा कि किसी भी लेबल के ऊपर दो पैनल होते हैं। दो पैनल होते हैं। एक पैनल होता है जो आप देख के फैसला कर रहे होते हैं कि आपने क्या चीज खरीदनी है, जो सामने शेल्फ के ऊपर डिस्प्ले के ऊपर लगा होता है, जिसको हम कहते हैं प्रिंसिपल डिस्प्ले पैनल। एक पैनल उसके साइड पे होता है जिसके ऊपर वो तमाम इंफॉर्मेशन लिखी होती है जो आप ऑफन नहीं पढ़ते, जो कि आपको पढ़नी चाहिए, जो हम ऑफन नहीं पढ़ते। तो किसी भी लेबल के ऊपर प्रिंसिपल डिस्प्ले पैनल्स मोर देन वन भी हो सकते हैं, और जो साइड्स पे होते हैं दे आर इंफॉर्मेशन पैनल्स, जहां पे तमाम इंफॉर्मेशन जो बाय रेगुलेशंस आपको डिक्लेयर करनी है या समटाइम्स आप मार्केटिंग के लिए वॉलंटरीली डिक्लेयर कर रहे होते हैं या लिख रहे होते हैं, वो तमाम पैनल इंफॉर्मेशन जो है वो आप इंफॉर्मेशन पैनल के ऊपर पुट कर रहे हैं। सो सबसे इंपॉर्टेंट जो पैनल है दैट इज नॉट ऑन, दैट इज प्रिंसिपल डिस्प्ले पैनल, जिसकी बेस पे आप किसी भी प्रोडक्ट को देख के आप ये डिसाइड करते हैं कि आप क्या खरीद रहे हैं। ठीक है, नेक्स्ट प्लीज। प्रिंसिपल डिस्प्ले पैनल के ऊपर होता क्या है? प्रिंसिपल डिस्प्ले पैनल के ऊपर होती है स्टेटमेंट ऑफ आइडेंटिटी, समटाइम्स उनका जो ब्रांड नेम होता है। ठीक है, और बाज़ औक़ात जो बहुत सारी कंपनीज हैं उसके ऊपर अट्रैक्टिव सी पिक्चर्स, वो फ्रूट की पिक्चर्स हो सकती हैं, वो जूस का स्प्लैश हो सकता है, वो सॉर्ट ऑफ किसी भी चीज का, जस्ट टू गिव इट अपील, कंज्यूमर को अट्रैक्ट करने के लिए प्रिंसिपल डिस्प्ले पैनल के ऊपर सबसे पहले स्टेटमेंट ऑफ आइडेंटिटी पुट करते हैं। स्टेटमेंट ऑफ आइडेंटिटी जिससे आप रिकॉग्नाइज कर रहे हैं कि व्हाट यू आर गोइंग टू बाय। सो प्रिंसिपल डिस्प्ले पैनल पे स्टेटमेंट ऑफ आइडेंटिटी इंक्लूडिंग इट्स नेम कि व्हाट द प्रोडक्ट इज, उसके बाद का ट्रेड नेम्स या ब्रांड नेम्स हो सकता है, और उसके बाद बाज़ औक़ात नेट वेट होता है प्रिंसिपल डिस्प्ले पैनल के ऊपर, जो आमतौर पे लेबलिंग के अंदर हम पुट करते हैं। नेक्स्ट प्लीज। नेक्स्ट, जो इंफॉर्मेशन पैनल है, इंफॉर्मेशन पैनल जैसे हम कह रहे हैं जो कि साइड पे होता है, उसके ऊपर आमतौर पे क्या होता है, न्यूट्रिशन फैक्ट्स होते हैं, इंग्रेडिएंट्स होते हैं, कंपनी का नेम एंड एड्रेस होता है, एलर्जी इंफॉर्मेशन हो सकती है, इंपोर्ट अगर कोई कर रहे हैं तो उसके मुतालिक हो सकती है कि कहाँ से है, कंट्री ऑफ ओरिजिन। तो इस किस्म की तमाम इंफॉर्मेशन जो है वो इंफॉर्मेशन पैनल के ऊपर किसी भी लेबल के ऊपर हो रही है। ठीक है, नेक्स्ट प्लीज। सो अदर कंपोनेंट्स ऑफ फूड लेबलिंग जो हम करते हैं उसमें मुख्तलिफ कंपोनेंट्स हैं, जैसे हमने पहले कहा प्रोडक्ट नेम और स्टेटमेंट ऑफ आइडेंटिटी फर्स्ट वन, देन इज नेट कंटेंट या सर्विंग इंफॉर्मेशन, देन नेम and address of manufacturer आ जाती है। Sometimes certain health claims भी होते हैं, though they are not being appropriately regulated in Pakistan, but they are also very important marketing tools also, nutrition or health claims। पाकिस्तान में इसको भी रेगुलेट करने की जरूरत है और बड़ा स्ट्रिंजेंटली रेगुलेट करने की जरूरत है। एंड देन वी आल्सो हैव दिस वेरी इंपॉर्टेंट इंफॉर्मेशन दैट इज सेल बाय और एक्सपायरेशन डेट। दे आर मोस्टली the key component of any labeling sort of any label. Other than that, there are sometimes some allergy information जो कि आपने declare होती है, करनी होती है अगर कोई allergen है, so इस किस्म की मज़ीद information भी हो सकती है. Next please. How the statement of identity can affect your choice. ये बड़ा important है. अक्सर हमने देखा होगा किसी दौर में मरिंडा के ऊपर भी even if we don't need to names, बहुत सारे कार्बोनेटेड बेवरेजेस के ऊपर भी फ्रूट की जो तस्वीरें बनी होती थी, जो कि अब फॉर्चुनेटली रेगुलेटरी बॉडीज दे हैव स्टार्टेड टू एक्ट. तो वो और इसी तरह से हम जब सब जाते हैं, हम में से बहुत सारे लोग जाते हैं मार्केट में जाते हैं, हम देखते हैं कि बहुत बड़ी फ्रूट की पिक्चर बनी हुई है किसी भी ड्रिंक के ऊपर, एंड व्हाट वी से, हमें मैंगो का जूस दे दें, हमें ऑरेंज का जूस दे दें. ठीक है, ये क्यों है? क्योंकि सॉर्ट ऑफ आपको उसकी जो प्रिंसिपल डिस्प्ले पैनल है वहां से आपको क्या लग रहा है कि इसके अंदर सर्टनली जूस है. क्यों? कि उसके ऊपर बड़ी सारी फ्रूट की पिक्चर बनी हुई है, बड़ा सारा जूस का स्प्लैश बना हुआ है, जो कि मेजर पार्ट है आपकी लेबलिंग का. आपके प्रिंसिपल डिस्प्ले पैनल का मेजर पार्ट क्या है? वो फ्रूट की पिक्चर है, वो स्प्लैश है. और इवन तो अगेन मैं बता रहा हूँ कि रेगुलेटरी बॉडीज दे आर कमिंग अप विद द सॉल्यूशंस. दे हैव सॉर्ट ऑफ मैंडेटेड कि आपकी जो स्टेटमेंट ऑफ आइडेंटिटी है, जिसको हम छोटा सा लिख देते हैं बास का, ये नीचे लिखा होगा मैंगो स्टिल बड़ा है, नीचे छोटा सा फ्रूट ड्रिंक है. अब ये फ्रूट ड्रिंक तक आपकी नजर नहीं जाएगी, आपकी जाएगी सबसे पहले इस तस्वीर पे नजर कि आप मैंगो का जूस पी रहे हैं, क्योंकि मैंगो बहुत बड़ा बना हुआ है, फिर नीचे भी मैंगो लिखा हुआ है, and then there is small letter that mentions that it is a fruit drink. और फ्रूट ड्रिंक के अंदर बाय रेगुलेशन यू आर सपोज टू हैव ओनली 8% फ्रूट कंटेंट या जूस कंटेंट. तो ये देखें कितना मतलब ये चीजें हैं कि ये स्टेटमेंट ऑफ आइडेंटिटी कैन बी सम टाइम वेरी ट्रिकी, दैट कैन इफेक्ट द चॉइस ऑफ आवर कंज्यूमर. और आप देख लें जैसा कि हमारी सोसाइटी में ये कॉमन प्रैक्टिस है कि हम जिसको जूस समझ के पी रहे हैं वो जूस नहीं है, जिसको हम दूध समझ के किसी दौर में पीते रहे हैं वो टी वाइटनर थे, जिसको हम मक्खन समझ के खाते रहे हैं वो मक्खन नहीं था. क्यों? कि जो आपकी स्टेटमेंट ऑफ आइडेंटिटी या प्रिंसिपल डिस्प्ले पैनल पे प्ले कर रहे हैं वो बहुत बड़ा सॉर्ट ऑफ एक जरूरी है कि उसको रेगुलेट किया जाए, लोगों को एजुकेट किया जाए कि यू डोंट जस्ट फॉल फॉर द पिक्चर. द पिक्चर्स कैन बी मिसलीडिंग. यू रियली नीड टू अंडरस्टैंड व्हाट इज द स्टेटमेंट ऑफ आइडेंटिटी. ये आपको पता होना बहुत जरूरी है. नेक्स्ट प्लीज. So there are many other brands जो कि अच्छा एक और भी बड़ा ये आजकल शुरू हो गया है, खासकर जो बच्चों के फूड्स हैं, बच्चों को आपने टारगेट करना है. आपने बहुत सारे देखे होंगे बच्चे सारे सुपर हीरो बनने के चक्कर में पता नहीं क्या क्या खा रहे हैं. ठीक है, एथलीट बन रहे हैं, जूसेस नहीं, एथलीट बन रहे हैं शुगरी ड्रिंक्स पी के. तो वो लेबलिंग इस तरह से की जा रही है, मार्केटिंग इस तरह से की जा रही है कि बच्चे they fell prey to this false marketing or sort of tempting marketing. तो मार्केट के अंदर जो बहुत सारी प्रोडक्ट्स हैं उनके अंदर वो मार्केटिंग इस तरह से कर रहे हैं कि बच्चों को अट्रैक्ट कर रहे हैं. ठीक है, नॉट ओनली बच्चे बड़े आसानी से वो मसलन इसमें कार्टून कैरेक्टर बना दिया, बच्चा सर्टेनली देखेगा he'll start flying once he drink this. तो इसके अंदर होगा क्या है? शुगर है, वेरी स्मॉल अमाउंट ऑफ फ्रूट जूस, शुगर, फ्लेवर्स एंड सम अदर स्टेबलाइजिंग एजेंट्स. ठीक है, तो ये बड़ा जरूरी है हमें एजुकेट करना और रेगुलेट करना, लेबलिंग को रेगुलेट करना बहुत जरूरी है. ठीक है, देयर आर ओके नेक्स्ट प्लीज. There are many other examples that you can sort of you can see. There are many sort of brands, many जो दिखने में क्या लगते हैं juices हैं, but actually they are not juices. They might contain small amount of juice just for the flavoring purposes, or they might just contain about 8% juice, and they are all drinks. They are not juice. So, but they look like juice. और आप देखें पाकिस्तान में हमारा मेरा ख्याल है लोकल कोई भी एक आध शायद जूस जो हमारे पाकिस्तान में लोकल मैन्युफैक्चर हो रहा है वो भी शायद ऑरेंज का जूस है, मेरा ख्याल है एक आध ब्रांड का है. अदरवाइज देयर आर ड्रिंक्स, नेक्टर्स, एंड वी ऑल कॉल देम जूसेस. Next, please. Next, please. Yeah, next, please. Same, ये थोड़ी सी मिस टाइपो है. Same, we have, मतलब हम में से बहुत सारे पढ़े लिखे, ये जब तक फूड अथॉरिटीज ने या ये रेगुलेटरी बॉडीज ने पुश नहीं किया, हम में से बहुत सारे लोग या अभी भी बहुत सारी जनरल पब्लिक वो यही समझती रही है कि टी वाइडनर्स दे आर सॉर्ट ऑफ मिल्क. वी नेवर ट्राई टू रीड व्हाट इट इज एक्चुअली. जो कि वो टी वाइडनर था, सिर्फ एक क्या था कि उस पे किसी दौर में मिल्क लाइक स्प्लैश था, मजीद रेगुलेट हो गए, उसको टी वाइटनर, अब स्प्लैश को कम किया गया और बड़ा क्लियर कट इन्हें लिखवाना शुरू कर दिया रेगुलेटरी बॉडीज ने कि ये दूध नहीं है, हमें ये बताना पड़ रहा है इट्स नॉट मिल्क. बट सिंस द स्टेटमेंट ऑफ आइडेंटिटी वाज नॉट वेरी क्लियर, इट वाज सॉर्ट ऑफ शैडोड बाय द स्प्लैश. इसी तरह से हम बच्चों को जो सॉर्ट ऑफ ड्रिंक्स पिलाते रहे हैं, बाज़ का वो शुगर्स enriched, sugar sweetened, but somehow it was sort of marketed as a dairy drink. Yeah, next please. Yeah, there are many other. ये इस किस्म के जो स्टेटमेंट ऑफ आइडेंटिटी का क्राइसिस है हमारा, वो और बहुत सारी चीजों में भी है. वो अगर ऑयल्स आप देखें, ऑयल्स में भी है. हम बाज़ का इस तरह से मार्केट कर रहे हैं कि इट कंटेन्स अ लॉट ऑफ ऑलिव ऑयल. जब आप इंग्रेडिएंट के अंदर जाते हैं तो उसमें ऑलिव ऑयल हो सकता है तीसरे चौथे नंबर पे हो, ठीक है, बट इट इज बीइंग मार्केटेड, उसके पैनल के ऊपर ऑलिव्स की तस्वीर होगी. हालांकि अगर ऑलिव तीसरे या चौथे नंबर पे है इंग्रेडिएंट में, तो सबसे पहले इसके ऊपर तस्वीर होनी चाहिए थी जो सबसे ज्यादा चीज है. सबसे ज्यादा चीज अगर कैनोला है तो कैनोला की सबसे बड़ी पिक्चर होनी चाहिए थी, वो कहीं पे आपको विजिबल नहीं होगी. दूसरे नंबर पे हो सकता है कैनोला के साथ कोई और ऑयल भी हो, उसकी पिक्चर भी नहीं है. तो ये हमें जरूरी है ये देखना कि जो आप मार्केट कर रहे हैं, मसलन कैनोला ऑयल है, सनफ्लावर ऑयल है, तीसरे नंबर पे अगर थोड़ा सा ऑलिव का एक्सट्रैक्ट या ऑयल है, तो फिर सबसे पहले जगह मिलनी चाहिए थी कैनोला को पैनल पे, फिर सनफ्लावर को, फिर थोड़ी सी जगह ऑलिव को भी मिल जाती जितनी उसके अंदर है. तो ये जरूरी है कि आप जो मार्केट कर रहे हैं, जो आप बेच रहे हैं, वो ट्रू टू इट्स आइडेंटिटी हो. ये हमें देखना और हमें रेगुलेट करना बहुत जरूरी है. नेक्स्ट प्लीज. Yeah, same as we already talked about, there are margarines that are being marketed. Yeah, they are being marketed now as a margarine because we have sort of clearly written ये मक्खन नहीं है, लेकिन बहुत सारे लोग हम जैसे इसे मक्खन समझ के कुछ अर्सा तक खाते रहे. अभी भी बहुत सारे लोग इसको, जो कि क्योंकि इंफॉर्मेशन इतनी नहीं है, लेकिन रेगुलेटरी बॉडीज दे वर आफ्टर इट, दे हैव सॉर्ट ऑफ पुश्ड वेरी हार्ड, और उन्होंने बार बार इसके SOS नोटिसेस और इस किस्म की आप स्टेटमेंट ऊपर लिखवाना शुरू कर दी, ये मक्खन नहीं है. सो देयर इज अ ग्रेटर पुश फ्रॉम द रेगुलेटरी बॉडीज. नेक्स्ट प्लीज. या अच्छा, और बहुत सारे लेबलिंग के इश्यूज होंगे जो कि रेगुलेटरी इश्यूज हैं. देयर कैन बी समटाइम्स जो इंग्रेडिएंट्स हैं वो नॉन कंप्लायंट हो सकते हैं, ठीक है, उसके ऊपर हम बाज़ का 100% प्योर, बट देयर आर इश्यूज ऑफ एडल्ट्रेशन, देयर आर इश्यूज ऑफ नॉन कंप्लायंस. नेक्स्ट प्लीज. अच्छा, हेल्थ क्लेम्स, ये एक बड़ा इंपॉर्टेंट टॉपिक है. बहुत सारी चीजों के ऊपर मिसलीडिंग हेल्थ क्लेम्स होते हैं. मसलन बाज़ का क्या करते हैं कि लो फैट पीनट बटर कैन बी अ वेरी अट्रैक्टिव क्लेम. ओके, क्योंकि आजकल लोग बहुत ज्यादा सेंसिटाइज हो रहे हैं क्योंकि जी फैट कम होनी चाहिए, लो फैट होनी चाहिए. ओके, आपने क्या किया, उस सेंसिटाइज्ड तबके को कैच करने के लिए यू सॉर्ट ऑफ पुट लो फैट पीनट बटर. अच्छा, ओके, इट इज लो फैट बट इट माइट कंटेन अदर थिंग्स. आप आगे जाके देखेंगे फैट काम में हो सकता है साथ साल्ट ज्यादा हो, शुगर ज्यादा हो, और बहुत सारी चीजें इसके साथ आपने ऐड अप कर दी हैं, जो कि आपने अगर फैट कम की है तो दूसरी तरफ से उन चीजों को ज्यादा करके आपने. Same low fat yogurt, yeah, it is low fat, but sometimes you add sugars. So उसमें sugar ज़्यादा हो जाती है. It contains, so it might be low fat, but it also contains sugars. And otherwise, sugar-free cookies, and there are many other things. If it is sugar-free, then it might contain also artificial sweeteners. So you need to look on those things also. It is okay, sugar-free or low sugar, but it might not contain other harmful ingredients. You have to look on those ingredients also. You have to interpret these health claims and nutrition fact claims very carefully, even though there are comprehensive regulations governing these health claims. FDA ने बड़े comprehensive regulations बनाए हुए हैं, EFSA European Food Safety Authority ने बड़े comprehensive regulations बनाए हुए हैं. पाकिस्तान में अभी मेरे ख्याल we are in the developing phase के जो health claims के regulations हैं वो मेरा ख्याल है बड़े अपडेट होने की जरूरत है और उनको रेगुलेट करने की जरूरत है. नेक्स्ट प्लीज. Then there are many other things like whole misrepresented food products. There can be juices that are sort of labeled as fresh orange juice, but they can be prepared from concentrate. We hardly have any fresh orange juice. I mean, they're all prepared from concentrate. Yeah, there can be whole grain bread also, but that contains a bit of whole grain and plus refined flour also. Next, please. There can be problem of origin and quality. Sometimes we also use very attractive names like Kashmiri tea, like Swiss chocolate, like wild caught salmon, just to attract consumer, but actually it is not. Next. There is a lot of usage of natural. You can see, I was looking at a chips brand. It mentions all natural, but it doesn't mention that how much, I mean, it mentions in the ingredient, but doesn't sort of highlight how much fat it contains. Okay, fat is natural. Fat comes from natural ingredients, but that doesn't mean fat is healthy. Fat is a lot of problematic. Then it might contain a lot of trans fat also, but they sort of market it as all natural. So yeah, but all natural, okay. There can be some natural ingredients, but there are many other things that are not natural. Yeah, they like all natural fruit jam, but it contains a lot of sugar, it contains preservatives, it contains colors, and so on. Next, please. Yeah, then there is another crisis also. A lot of statement of identity crisis. There is misbranding. There's so many super biscuits on the shelf. They look similar, just they change a bit. Super, because this regulations are weak in our countries, and many brands they sort of imitate. They just do misbranding. You need to be very careful while selecting these foods. There can be extremely low quality products with exactly similar looking tags and labels. So you need to be very careful also in that aspect. Next, please. Yeah, then there is also very sort of problematic labeling. Yeah, they claim sometimes no cholesterol. Okay, cholesterol is not present in plants. All right, but cholesterol is, there is no cholesterol. That is evident. You don't need to state the evident facts because it is coming from plants and plants are not the source of cholesterol. But what else it contains? It contains a lot of saturated fat. It might contain a lot of trans fat, but okay, it is no cholesterol. So they don't mention that it contains a lot of saturated fat, even though now the regulations, they demand that you need to mention saturated fat, but they don't mention trans fat because regulations, they have sort of window, okay, but they highlight no cholesterol, and many sort of consumer, they are tempted to buy these products even if they contain a lot of fat, even if they contain trans fat, but they just write no cholesterol. So you need to be careful while choosing these products. Next, please. Yeah, there are many cases. The regulatory bodies, they are already after it. They sort of identify, they penalize many brands that are sort of misleading labels. Next. Yeah, similar examples. There are many other. The regulatory bodies, they do sort of frequent inspections. Yeah, the monitoring also. Yeah, next, please. Next, sir. Yeah, next, please. Yeah, then there are many tea brands also. They are sort of selling with big claims, with 100% natural. जैसे हम देखते हैं कीनिया के बागात से लेकिन वो फ्लेवर्स ऐड कर रहे हैं। देखें टी जो है इट्स नॉट मेंट टू बी अ फ्लेवर्ड ड्रिंक, इसका अपना फ्लेवर होना चाहिए। ये बड़ा जरूरी है कि टी का अपना फ्लेवर होना जरूरी है, बिकॉज टी इज मेंट टू बी टू प्रोवाइड इट्स ओन फ्लेवर, बट मैनी टी ब्रांड्स दे आर एडिंग आर्टिफिशियल फ्लेवर्स, artificial colors also. Yeah, that we need to look at. I mean, there are many brands, many flavors in the tea also available. Next, please. Then, yeah, some sort of organic and ecological, biological foods, they find somehow some window to falsely market. Okay, there are very stringent regulations, very stringent certifications for organic, but they don't label organic. Sometimes they say all natural, eco-friendly, GMO free, yeah, similar kinds of labels they use to just promote their products. So we need to be very careful when we read labels. Next. Yeah, like here we have made a distinction between organic and natural. So anyone can use this natural label, but to use organic, you need to undergo stringent requirements for organic. Like if the ingredients are coming from nature, and even if they are heavily processed, they contain a lot of salt, they contain a lot of sugars, they contain a lot of fats, you can still call them natural because they are coming from nature. But yeah, for organic, you need to follow stringent standards. Like yeah, high fructose corn syrup is also natural. Yeah, so yeah, we need to be very careful when choosing products labeled as all natural or natural, please. Next. Next, please. Yeah, how to read ingredient list. Remember, the ingredient list is listed in descending order. The ingredient with highest amount comes first, and the ingredient with lowest amount comes last. ठीक है, ये हमें बड़ा जरूरी है, हमें पता होना चाहिए कि जो सबसे ज्यादा इंग्रेडिएंट है वो सबसे पहले होगा। अब पानी भी रेगुलेशंस में आ गया कि अगर आप पानी प्रोसेसिंग के अंदर दौरान ऐड कर रहे हैं और वो पार्ट ऑफ प्रोडक्ट है तो आप उसको लेबल करेंगे। तो ये बड़ा अच्छा कर दिया है, पहले शायद जो पीएफए के रेगुलेशंस थे उसमें नहीं था, अब हार्मोनाइज्ड रेगुलेशंस में water as an ingredient they have sort of made it mandatory. So you need to be careful to read ingredients, what they are, and they always are listed in descending order. Next, please. Yeah, expiry and best before, that is also very important consideration you need to look at. Expiry is, you need to be careful when there is expiry date. After that date, food is not safe to be consumed. If there is a date mentioned as expiry date, you shouldn't consume food after that date. And if it is mentioned best before, that means after this date, food might still be safe, but it may not retain optimal quality. It may not be in the best shape, but it might be safe to consume when there is written as best before. Next. There must be, we need to be careful when choosing some ingredients. There can be some serious allergens. You need to check allergy warnings. They are often mentioned on the label, so you need to read those allergic warnings also. There are many ingredients, particularly nuts and protein-based ingredients that can carry allergy to people, so you need to read allergy warning also. Next, please. Yeah, tips for consumers. Remember, whenever you are purchasing any food, remember you need to focus on health claims. They can be misleading sometimes. Many times they can be misleading because in third world countries like Pakistan, these health claims, they are poorly regulated. Then you need to read the ingredient list. You need to pay attention to serving size. Don't look at the volume or weight of the pouch. You need to look how many servings it provides. It can be quite energy dense. So a small pouch can provide you many servings. Then you need to look at calories. You really need to look at fat, total fat. There are foods that contain as much as 40% fat. So it's a lot of fat that are commonly available in our market, 35% fat. So it's a lot of fat, and there is a lot of saturated fat also. So you need to check on those ingredients. You need to look for sugars, how much sugar it contains. There are many foods which contain chocolates, like they contain a lot of sugars, but we are eating them in abundant amounts. Tang is more than 90% sugar, but we are drinking it as a sort of drink, fruit, assuming as a fruit drink. So you not only need to look at calories, fats. In fats, you also need to look for trans fats. That is very important and one of the major aspects of our training, of our workshop today. Trans fats, as Zubair Saab has rightly explained and talked about trans fats, Pakistan is lagging behind. We have not mandated to declare trans fat for all foods. There are regulations for some foods, but not for all foods. So there are foods which contain a lot of trans fat, but they are not supposed to mention on the label. So we need to make it mandatory for trans fat regulations, and we need to look for trans fats because trans fats are the major risk factor for many NCDs. So you really need to be mindful of salt. There is a lot of salt in many foods, particularly baby foods. They all contain mostly bad ingredients. All the baby sort of snacks, they contain sugars, a lot of sugars. They contain a lot of fats. They contain a lot of sugars. So there is nothing which is sort of healthy. So you really need to look at those and aim for higher nutrient density. Go for foods that contain higher nutrient density. They are minimally processed. You need to avoid ultra processed foods. Next, please. Yeah, there are some red flags we already talked about. Watch for high fat, monitor sugar levels, limit sodium intake, inspect ingredient list, and check for serving sizes. Next, please. As we already mentioned, you need to be careful when choosing these things. You always need to pick the healthiest, which contain less fat, which contain less saturated fat, less sugar, less sodium. And in many countries, front of warning labeling is being made mandatory. The Pakistanis also need to regulate this labeling. We need to make mandatory front of warning labels. There can be many simpler ways to label harmful ingredients on the labels, but we are lacking on this. We have sensitized PSQCA, we have sensitized the regulatory bodies that they need to come up very quickly this front of pack warning labels. There must be warning signs, simpler, easier to understand for the consumers. Yeah, next please. Yeah, yes, it's same. Front of warning label can be in different color codes. Green, you always opt for green. Yeah, you need to be mindful of yellow, and you really need to avoid the red categories, which contain a lot of sugar, salts, and fats. Next, please. Yeah, yes. So I have tried my level best to sort of explain what is present on the labels, what we need to be careful, and what we need to look at when we are reading labels or when we are deciding what to eat and what to avoid. So we need to look at ingredients, we need to look at red flags, we need to carefully inspect or look at the statement of identity, and we need to choose wisely, choose minimally processed food. We need to avoid ultra processed food. Thank you very much, SDPI. Thank you very much, all the distinguished guests, and Yahya Saab. I am up for the questions. Thank you. I'm sorry if there is any disruption because I was another seminar and I am sitting in the hotel lobby and there is a lot of rush also. Thank you.
Thank you so much, sir, for a very descriptive presentation on labeling norms and all. We have few questions for from the participants. So moving on to our first question, is ITFA part of labeling internationally or just in Pakistan? The labeling of ITFA.
Labeling of ITFA has been made mandatory in many parts of the world. In Pakistan, we have not made it mandatory across the whole supply chain. We have made it mandatory for some categories of foods, like we have made it mandatory for some bakery items, for these oils and vanaspati ghees, but we have not made it mandatory for all foods, like chips. They are big source of saturated fat, and they also contain trans fat. The low quality these chips, you see there are so many varieties on these snack items. They contain a lot of fat, but there is no labeling about trans fat. So I think we need to make it mandatory for all food items. They must label trans fat as part of their ingredients in order for us, the consumers, to decide how much trans fat is there, and we can then decide wisely. But it is part of labeling requirement in most of the countries, not Pakistan.
Thank you so much, sir. Sir, we do have another question. Have academics ever write or highlight to PSQCA regarding or regulatory bodies about false labeling?
Yeah, that is very important. Regulatory bodies, they are already up. They have made tremendous contribution and achievements. You know, what we used to eat, there was a time when Brinda had sort of big orange splash. No more. There was time once these dairy drinks, they were marketed as a sort of milk, because there was big milk splash, but it contained a lot of sugars. And the regulatory bodies, they come up and they sort of stringently enforced these sort of mislabeling. Yeah, academia, we also sort of sensitize. I frequently interact with regulatory bodies, and we sensitize them that you really need to come up. You cannot sort of trap the children particularly, because there is a huge problem with labels for foods aimed to be marketed to children. There are pictures, the children are becoming superhero by eating a lot of saturated fat, by eating a lot of salt. And all these snacks, they are making them superheroes. There are cartoon characters in it. And the children, they keep buying to collect the cartoon characters, which is false, which is wrong, which is playing with the health of the children. And we keep highlighting, and we keep highlighting through this platform and many other platforms also, when we invite regulatory bodies, that you need to come up, you need to regulate this. You cannot allow food companies to use children as a sort of, they cannot. I think this is unjust, this is unethical, that children are being fed unhealthy foods by attracting them.
Thank you so much, sir. Sir, there's another question. What regulatory bodies do against these wrong identity claims and statements?
Yeah, the regulatory bodies, they are trying their best. Again, regulatory bodies have capacity issues. And then many of these companies, they sort of operate under a sort of shadow. They don't sort of, even though they have made it mandatory for a kulfi seller to declare its address, but they don't. The food laws, they make it mandatory कि जो भी आइसक्रीम बेच रहा है रेडी पे कुल्फी वाला, वो अपना नेम और पता बताए, लिखे ऊपर के वो कहाँ से है. नहीं लिखते. क्यों नहीं लिखते? कि वो पकड़े जाएंगे. पकड़े जाने का. अब रेगुलेटरी बॉडीज पाकिस्तान में प्रॉब्लम्स ह्यूज हैं. Regulatory bodies, they work on policy level. They sort of streamline regulations. They do sort of fines also. They are after these violators continuously. And Madam Tahira might be in a better position to apprise how many sort of false labeling issues they are handling and how many people they are being fined. But still, these people, they operate in a territory which is sort of gray area. There was a time stations, वहां पे आप देखें, वहां पे ट्रेन्स के अंदर किसी दौर में ये तमाम जो 3-3, 4-4, 10-10 नंबर चीजें हैं, वो एक वो सुपर का ज्यादा कर दिया, SOU कर दिया, इस किस्म के वो वहां पे बिक रहे हैं. तो ये इस किस्म के मसाइल हैं काफी सारे, जो कि रेगुलेटरी बॉडीज की कैपेसिटी तो है, लेकिन बाज़ का हमारे मसाइल और चैलेंजेस बहुत ज्यादा हैं, जिसकी वजह से अभी तक भी ये फॉल्स लेबलिंग और ये चल रहा है.
I see. Thank you so much, sir. Sir, there's another question. Can you guide us regarding what type of brand should one use particularly to tackle this ITFA problem? What oil
What
will
type
you
of brands we should look at?
brand or oil?
Yeah, that is very tricky. That is very tricky. Again, evidently जो clear cut path है वो तो यही है कि आप उन्हीं brands को लें जो VTF free हैं. और again जैसे जुबैर साहब ने बड़ा clearly बताया है कि जो PHOs हैं उनको आप किसी सूरत consume ना करें या जो saturated fats हैं उनको consume ना करें. Trans fat is one problem which is very big problem. It can be problematic in very small amount. But saturated fat is equally bad again. It can be problematic in higher amount. So we need to be very careful. We need to cut on our oil consumption. Frankly speaking, in Pakistan, we are consuming about 24, 25 kg oil. In India is about 18, 19 kg, I guess, per capita oil consumption. So we really need to cut down our oil consumption, our fat consumption, which is a bit too high. So एक तो हमें as a general principle हमें ऑयल का इनटेक कम करना है एज अ नेशन. एक तो इससे हमारी हेल्थ का फायदा होगा, दूसरा हमारा रेवेन्यू बचेगा, तीसरा और बहुत सारे इसके जो हमें फायदे हैं, हमारी हेल्थ, रेवेन्यू, ऑल दोस थिंग्स. नंबर 1. Number 2, you always opt for oils instead of fats. Always opt for oils which are unsaturated. You don't go for saturated or fats या घी जिसको हम कह रहे हैं या वनस्पति कह रहे हैं उसके ऊपर ना जाएं. अगर आपने घी इस्तेमाल करना है, there are brands, very few which sort of are VTF free. They claim as to be VTF free, but again घी है तो वहां पे saturated fat का भी issue आ जाएगा. तो VTF तो ठीक है, virtually trans fat free हैं, but they contain a lot of saturated fat also. So you look for VTF. So ultimately we have to look at the labels, what they claim, what they say on the label. So you need to opt VTF brands.
Thank you so much.
There is
Yes, ma'am.
I think important. In the Q&A, there is a question: if there are harmful ingredients, who has approved them? So, or if there are any departments which can check them, so they must be banned if harmful. How we can raise voice against these brands? These are almost 3 questions, I think. So, who has approved them first? Dr. Al-Arakasa. Thank you.
Sorry. So, madam, there are harmful ingredients. Look, there are harmful ingredients in the supply chain. Like we have some issues of pesticide residues, we have issues of aflatoxins, we have issues of heavy metals, we have so many issues. Again, there are harmful ingredients. Sometimes there are excessive ingredients, like there are preservatives, there are coloring agents. अब मसला ये आएगा, again, regulatory bodies के पास कैपेसिटी टेस्टिंग की नहीं है उस हिसाब से. आप पेस्टिसाइड रेजिड्यूज को आप कंटिन्यूअस मॉनिटर करते हैं. हमारी सप्लाई चेन में शदीद पेस्टिसाइड रेजिड्यूज, बहुत ज्यादा पेस्टिसाइड्स का यूज है. फ्रॉम जो फ्रेश प्रोड्यूस है, पर्टिकुलरली वेजिटेबल्स, वहां पे पेस्टिसाइड रेजिड्यूज का बहुत ज्यादा यूज है. अब अच्छा, शाम को स्प्रे करते हैं, सुबह वो मार्केट में, परसों आपके किचन में, एंड यू आर ईटिंग इट. Many of these products we are consuming fresh without even cooking, or sometimes we even don't wash. So that is also big problem. अच्छा, एक तो regulatory bodies का बहुत सारे टेस्टिंग के कैपेसिटी के भी इश्यूज हैं. ठीक है, कितने टेस्ट करें? टेस्टिंग इज क्वाइट एक्सपेंसिव. Testing is quite expensive, and then there are hardly labs that are accredited. So there are very few labs that are accredited. एक तो ये मसला है कि जिसकी वजह से हमारी जब सप्लाई चेन है उसमें हार्मफुल इंग्रेडिएंट्स कंटिन्यूअसली वो प्रेजेंट हैं, अबव द लेवल्स हैं जो कि फूड जो रेगुलेटरी बॉडीज ने डिसाइड किया हुआ है, स्टैंडर्ड्स में क्या कहा हुआ है, उसमें बहुत सारे अबव द लेवल्स हैं. और उसके मसाइल वही हैं कि हमारे या बहुत सारी जगह पे लूप होल्स हैं जहाँ पे जो हमें प्लग करने की ज़रूरत है. ऐसी पेस्टिसाइड्स मार्केट में अभी तक अवेलेबल हैं जो 10-20 साल पहले भी बैन हो गई थी, वो अभी तक अवेलेबल हैं. अच्छा, दूसरा पार्ट क्या था मैडम? आई एम सॉरी, आई कैन नॉट हियर. या साहब आप एलैबोरेट कर सकते हैं? Sorry.
I will request the ma'am again to describe or elaborate on the question, please?
Okay. 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 There is
Any
issue of
department
voice.
which can track them. Approval का ज़्यादा मैं concern थी कि who has approved them. Is there any regulatory body who approves the labels?
Madam,
That is-
labels. अब जो regulations again, जो standards हैं, they are with the PSQCA. PSQCA is approving the regulations. Enforcement is with provincial bodies. मसला ये है मैडम कि बाज़ का बहुत सारे तो ऐसे ब्रांड हैं जो अप्रूवल के बगैर ही चल रहे हैं, जो खासकर नॉन कंप्लायंट ब्रांड्स हैं, वो अप्रूवल भी नहीं लेते क्योंकि वो ग्रे एरिया में काम कर रहे होते हैं। नंबर 1 के बहुत सारे बगैर अप्रूवल के। दूसरा, जब अप्रूवल लेते हैं फिर उस क्वालिटी को मेंटेन नहीं रखते बहुत सारे जो ब्रांड्स हैं। प्रोडक्ट की अप्रूवल ले ली, बट देन इट्स अ कंटिन्यूअस प्रोसेस। क्वालिटी एश्योरेंस QA QC जो है वो कंटिन्यूअस प्रोसेस है। दे डोंट डू दिस, इट इन्वॉल्व a lot of cost also. So maybe then that is another issue, that they don't follow these regulatory standards that are being that they are supposed to follow, I guess.
I just want to add something.
जी मैडम ताहिरा मैडम।
हाँ, मैं ये बात करना चाह रही हूँ कि सर थैंक यू सो मच, आपने बहुत अच्छी लेबलिंग के ऊपर इतनी कम्प्रिहेंसिव प्रेजेंटेशन दी। ये जो लेबलिंग का डॉक्टर रजिया पूछ रही थी, इसका PSQC के पास पावर है, क्योंकि हार्मोनाइज स्टैंडर्ड्स होने के बाद जब स्टैंडर्ड्स फाइनलाइज होते हैं PSQCA की मीटिंग में, जिसमें सारी रेगुलेटरी बॉडीज के टेक्निकल पर्संस मौजूद होते हैं, तो उस स्टैंडर्ड के साथ उसका सैम्पलिंग प्रोटोकॉल, उसका लेबलिंग का सारा प्रोटोकॉल वो मेंशन होता है उसी स्टैंडर्ड के अंदर। PSQCA की वेबसाइट पे इस वक्त मतलब 400+ स्टैंडर्ड्स जो हैं वो अवेलेबल हैं, जो हार्मोनाइज हो चुके हुए हैं, और उसमें से आप कोई भी आप स्टैंडर्ड उठाएंगे उसके अंदर उसकी लेबलिंग का भी कोडेक्स एलिमेंटेरियस के मुताबिक मेंशन किया गया है, जो भी स्टैंडर्ड्स हैं। ये है कि जैसे इन्होंने कहा कि हमारे पास चूंकि रेगुलेटरी बॉडीज के पास बहुत सारे इश्यूज हैं, हमारी कैपेसिटीज कम है, लेकिन जहां तक हमारा लेवल है हम मैक्सिमम कोशिश कर रहे हैं एज ए रेगुलेटरी बॉडी कि हम इंश्योर करवाएं उस लेबलिंग को भी, और जो उनकी क्वालिटी है उसको मेंटेन करवा सकें। लेकिन बिल्कुल ग्रे जोन भी उसमें आ जाता है, और ग्रे जोन के अलावा फिर बहुत सारा ये है कि ऑल टाइम टीम अवेलेबल नहीं हो सकती। जैसे आप ये देखेंगे 1122 के बाजू का लोगों का कॉन्सेप्ट ये होता है कि हमने कंप्लेन की है, जस्ट लाइक 1122 फूड सेफ्टी टीम पहुंच जाए। उसके लिए हमारे पास उतनी मैन पावर होनी जरूरी है ताकि एक टीम जो है वो 24 आवर सर्विलेंस पे अवेलेबल रहे मुख्तलिफ एरियाज में। तो होप सो इन फ्यूचर ये सारी चीजें हो जाएंगी इंशाल्लाह।
मैं इसमें कोई पॉइंट ऐड कर सकता हूँ?
जी सर।
अच्छा, यार चूंकि हमारे पास सेमिनार में मुझे लगता है स्टूडेंट्स भी हैं, पॉलिसी के रिसर्चर्स भी हैं, तो आई थिंक ये जानना बहुत ज़रूरी है। एक तो ये कि एक नोहा है पाकिस्तान का कि हमने ये जो हम आराम से कहते हैं कि हम साइंस एंड टेक्नोलॉजी में पीछे रह गए, तो ये स्टोरी, ये कहानी जो आपको इस वक्त इतनी पेनफुल लग रही है, और पाकिस्तान में देयर इज एन इंक्रीज ऑफ नॉन कम्युनिकेबल डिजीजेस एंड 65% of deaths in Pakistan happen because of non-communicable diseases. And almost every Pakistani on average dies a premature death. हम पाकिस्तानी उस वक्त मरते हैं जब उसको मरने की अभी जरूरत नहीं होती, यानी कि हमारी जो एवरेज एज है वो 65, 63, 67 इसके गिर्द कहीं घूम रही है, जबकि 80 से 79 से पहले अगर डेथ होती है तो दिस इज अ प्रीमेच्योर डेथ ग्लोबल स्टैंडर्ड के मुताबिक, ये प्रीमेच्योर। सो एवरी पाकिस्तानी डाइज व्हेन इट कैन स्टिल लिव, सो वी लूज पीपल्स लाइव्स, मोस्ट यूजफुल लाइव्स। अच्छा, और यहाँ पे जब ये फौत हो रहे होते हैं उससे 10 साल पहले ही बीमार हो जाते हैं। वो वक्त जिस वक्त मोस्ट प्रोडक्टिव पाकिस्तानीज हो सकते हैं, जिस वक्त उन्हें अपने बच्चों की शादियां करनी है, जिस वक्त उन्होंने अपने पेरेंट्स का ख्याल करना है, जिस वक्त इस सोसाइटी को बहुत कुछ देने के काबिल हुए हैं, उस वक्त पाकिस्तानी बीमार हो रहे होते हैं और जा रहे हो। सो दिस इज समथिंग विच इज वेरी सीरियस इन मैनी वेज। तो आपकी जो स्टेट ऑफ साइंस एंड टेक्नोलॉजी है कि यू आर नॉट एबल टू प्रोड्यूस टेक्नोलॉजी विच कैन क्रिएट health food safe for consumption, and you cannot even test food. ये महंगी इसलिए है कि आपके पास इंडिजिनस कैपेबिलिटी नहीं है किसी भी चीज को करने की। दिस इज व्हाई Myself as a researcher in a way, and also a policy person, we always argue that make a lot of investment, a very serious investments in building capacity or capability of Pakistani students in science and technology, and allow the bigger firms to operate. सिर्फ डॉक्टर्स या इंजीनियर्स की तादाद बढ़ाने से मुल्क ठीक नहीं होते. यू हैव टू हैव बोइंग और वॉक्सवैगन और बिगर फूड कंपनीज इन पाकिस्तान. सो वो लोग जो पाकिस्तान में इंडस्ट्री के खिलाफ बहुत बड़ा आर्गुमेंट बिल्ड कर रहे हैं इस वक्त, कुछ ग्रुप्स हैं पाकिस्तान में, और वो फूड टेक के खिलाफ भी खड़ा कर रहे हैं एक महाज. they must also know that Pakistan requires a lot of investment in science and technology, and you need scientific brains. You don't need a person who can read science, but a person who can use the scientific method of reasoning. ये सारी चीजें आपको चाहिए इस बड़े प्रॉब्लम को, जो एक बिगर लूप है उसमें, जो इसकी छोटी लूप है ना, जो रेगुलेशन के साथ जिसका ताल्लुक है, वो दैट इज वेरी इंपॉर्टेंट. पाकिस्तान में अभी लॉज, पाकिस्तान के अंदर एक तो इंस्टीट्यूशनल अरेंजमेंट्स ही मौजूद नहीं है जो इसको कॉम्प्रिहेंसिवली अनएम्बिगुअसली पीछे जा सके, इन चीजों के, इसको रेगुलेट कर सकें. यानी कि आपको दुकानों पे नहीं जाना है, आपको फर्म्स के लेवल पे जाना है. सो एक्चुअली योर यूनिवर्स इज स्मॉलर देन व्हाट वी थिंक. अब पूरा लाहौर नहीं फिर सकती पंजाब फूड अथॉरिटी, या पूरा पंजाब नहीं फिर सकती. 60% ऑफ पाकिस्तान की पॉपुलेशन घर घर जाके चेकिंग. यू नीड टू एक्चुअली लुक एट द पॉइंट्स ऑफ ओरिजिन. वो वहां पे आपको जाना है जहां पे ये चीजें. इसलिए हम ये आर्ग्यू करते हैं कि आपने सिर्फ 155 पाकिस्तान में ऑयल मिल्स हैं, घी की मिल्स हैं, और उसमें से आई थिंक 35 या 36 ऐसी हैं जो ये इंडस्ट्रियली हाई क्वांटिटी में ये प्रोड्यूस कर रही हैं. अच्छा, कुछ फर्म्स हैं जो बड़ी फर्म्स हैं जो 3-4 ब्रांड तो वो अच्छे निकालती हैं, 2-4 जो सस्ते वाले हैं उसमें ITFA ज्यादा है. सो यू नीड टू टॉक टू 155 इंडस्ट्रियल यूनिट्स, सिंपल एज दैट. अच्छा, एक तो ये पाकिस्तान के इंस्टीट्यूशनल अरेंजमेंट्स का आपको इसमें पाकिस्तान को बहुत सीरियसली काम करने की जरूरत है, जिसको मैं कहता हूँ कि पाकिस्तान की फूड गवर्नेंस को इम्प्रूव करने की जरूरत है, और गवर्नमेंट ऑफ पाकिस्तान को बहुत सीरियसली लेने की जरूरत है, क्योंकि अर्बनाइजेशन हो रही है, लोगों के लाइफस्टाइल चेंज हो रहे हैं, इसी तरह डिजीज चेंज हो रही है, इसी तरह ट्रीटमेंट्स चेंज हो रहे हैं, और हम सारी चीजों में पीछे हैं. तीसरा है पीनल एक्शन का, कि आपकी जो लॉ एनफोर्समेंट है उसको एज वन गवर्नमेंट आपको चलना है. मुझे लगता है कि अभी तक जो फूड अथॉरिटीज हैं और डिपार्टमेंट, दे डोंट टॉक टू वन.
To intervene this descriptive discussion, we are short on time and we still have one presentation remaining.
यही साहब, मेरा एक लास्ट कमेंट है. यही साहब, एक लास्ट कमेंट दे दूं मैं, फिर उसके बाद आप नेक्स्ट मूव कर जाएं. शॉर्ट
cutting you in between, please.
जी दे सकता हूं सर.
Please continue.
अच्छा सर, मैं एक सेमिनार में था आज, वहाँ पे डेनमार्क के एम्बेसडर थे, उन्होंने बड़ी अच्छी बात की. उन्होंने कहा पाकिस्तान जो है ना, वो आप फ्रूट्स और वेजिटेबल्स और इसकी वैरायटी देखें, इज एनरिच्ड, लेकिन हम इन्वेड हो गए हैं बाय sort of junk food. Pakistan is invaded by junk food. This is somehow we need to look on, that we need to stop this invasion. We really need to look for healthier options that we are blessed. Thank you very much, sir. Thank you.
Thank you so much, sir. Dr. Razia, I invite you to deliver the presentation. Over to you, ma'am. Thank you.
Okay, thank you very much. I think we must thank you, our panelists, for such an enriched discussion, and I'm really thankful. And my presentation is all, I think it will be the mix of all of these discussions, as well as the overview of the food industry and the nexus of the health and the food industry. So the topic, as you have seen, that it is advocating for stricter regulations and improved practices in the food industry, the role of health professionals. Next, please. So this is just to bring to your notice about this is a heat map of all the European countries, which according to the priority or in the of the risk factors for the health. So the dietary risks are on the first priority of the many countries, most of the countries, except the Netherlands, which is the second, Netherlands and Denmark, where it is the secondary, second priority. Next, please. So there is a nexus between the health and the food industry. So how can we describe it? That food industry is it encompasses everything from farming to retail and to the consumer. Or you can say it from farm to fork, but it's this terminology is usually not used in the food safety. So the health and safety is a crucial aspect of the end user for the end users of the goods it produced by the food industry. So it is their moral and ethical duty to uphold the highest standards of health and safety in addition to being required by the law. So there is a terminology used for the self-regulations, which we will describe later on. So it's their moral and ethical duty to make it standard, to follow the standards. And on the other hand, the medical professionals can influence the public understanding of what is about the food and how the food can affect their health. So there must be an increased attention, maybe enable them to promote the food safety knowledge more actively in their work. Like, for example, as Mr. Zubair has said, that the healthcare professionals also need to be to gain the knowledge, more knowledge about the food safety. What are the effects of the food? So they're increasing their knowledge can improve this condition. And they can also promote a better understanding of the food safety and protect the health of the general public. Because when they are talking to their patients, or they are as an academician, they are talking to the students, or in the conferences or in seminars, they can be more effective in this on this aspect. Next, please. So there is we need to have a food advocacy for this purpose. For the example, for the ITFA consumption, or the loading the ITFA in all the products, as we have mentioned that the PSQCA has set the standard for the 2%, but for the some foods, it's not all over. So we need to. But there is a challenge. There are challenges for the health professionals also. So on the one hand, today's food system is associated with the production of unhealthy products. There are increased food waste, environmental degradation, including elevated carbon emissions, biodiversity loss, and the pollution of air, land, and water. So this is all included in the food system, which is a new, I think, new systems which are being followed by the most on the food security side, but we can, but there are some components of the food system, food safety side. So the sustainable food advocacy with its focus on the promoting health and environmental sustainability through conscious food choices and practices is the challenge. So the healthcare professionals and other allied health professionals, they can play a vital role in advocating for the planetary health. And so promoting the sustainable dietary guidelines, they can do it by promoting the sustainable dietary guidelines and the policies. Next, please. So where the health professionals can enter. So the previous studies has shown that the communication between the specialists and the patients may therefore improve the patient's awareness of the food safety. So we can enhance the demand side of the food safety, which can be effective advocacy. So it is seen that the individuals at risk are more likely to listen to the dietary and the food safety advices of the medical professionals. So it is varying levels of the knowledge. So on the medical professional side, there is a varying level of the knowledge on food safety, which in turn may limit the understanding of those in their care. So that is also important, that the medical professionals or the health professionals need to increase their capacities, particularly for the today's topic, because it's not much discussed topic, but now we have put, we are making the, like, I think a lot of people are working on this, and this can, and for this, I will give an example of COVID-19. During COVID-19, in the beginning, this was the thesis that it is because of consumption of some foods or some type of animals, which started this disease in China. And they started off a study on that about the food safety, and they were very concerned about the food safety and all the they put this food safety in center of their management, and in all hospitals or all health professionals were trained on that, and they could see that there was the knowledge about food safety was less before the COVID-19, and it enhanced during the COVID-19, and now they have put it the food safety component is very much into their health professionals trainings, as well as they are more aware of that. So, the first intervention or the window of the point of entry can be the hospital diets. For example, the hospital diets are obviously the health professionals, nutritionists, and the doctors or the people who are dealing with the patients can also improve that. That can be the good entry point to improve the diets. Next, please. Next. So I have just listed out these role of health professionals. Evidence, first is evidence generation or evidence compilation. We discussed about the best practices or the all the countries who has, like India or other countries who has adopted the best practices policies. In this ITFA section, WHO has recommended the replace, as well as there are the best practices which are there are I think 4 or 5 listed best practices which are and one of them is elimination of the ITFA from the food. So these we can compile these best practices activity, and we can compile the studies which are outside our country, and we can contextualize in this country, and we can this can be the health professionals' responsibility, who can communicate this to the food industry from their own forums. And I'm 100% sure that the food industry also listens to these new things, or the which is like obviously affecting the health of the people. So they are receptive on that. And second is the hardcore research, which can be indigenous, which can be according to our products, according to our population, because you know the effect of these products, the diets or the diets can be different in different variability. Like for example, the diabetes, which can be Pakistan is already having a good number of obesity. So these diets can affect more in the Pakistan as compared to the other countries. And our lifestyle is like that. So indigenous research can also be important, and the health professionals can contribute with that. And they can do the food advocacy on this. And making the guidelines. Guidelines, we can adopt the guidelines from the international guidelines, but at the same time, as I have explained previously, that we need to have our own guidelines according to our size, our population, socio-demographic, as well as our other genetic predisposition to the diseases. And increasing demand of the patient awareness, that is very important. As I mentioned earlier, that when a specialist talks to a patient, they listen to that. And these increasing the demand of the patient awareness, with patient awareness, that will be very effective advocacy tool to bring the pressure groups to the food industry who are not following the standards. And then capacity building of the healthcare workers and the food industry, and representation. And these health professionals should be represented at they can be good advocate at the policy making level. And another thing is that the monitoring, we have talked about the label, we have talked about the content, we have already talked about the NCDs, but how these effects are monitored, how these effects are being monitored. Is there any feedback from the industry, from the consumers, or do we have any consumer bodies which can give us the, like for example, the label, and where there are there any forums where they can speak about that? And food system approach, as I mentioned already, that this is food system approach is more in the food security side, but it encompass the food safety as well. So the food safety, there are food safety frameworks which encompass the monitoring, and also that they give the feedback. And this is not a static process. This is reiterative process, and they can, so that we can do the amendments. And advocacy for the regulation and self-regulations. There are examples of self-regulations. For example, obviously the regulations that PSQSA has put the standards. So we should try, and we are trying to implement those standards, and that is why we are here. But the self-regulation is also a good examples in other countries, like in USA. Like the schools were they were self-regulating. They were not using putting the fizzy drinks in their schools, but there were self-regulation. They can think about the business is there. So, for example, in the primary school, who are not the users of these fizzy drinks, like obviously in elementary schools, the children are small, but the teenagers who uses the more drinks, that was not implemented in the secondary schools. So these self-regulations also need to be looked into. And food safety, hospital diet alternatives to the healthier options, like at the hospital diets can be the entry point, and then we can regulate them. And in this aspect, we can, and there is we need to make a sustainable food environment, and the community engagement. Community engagement can also, the health professionals can play their role in community engagement as the patients' pressure groups, building up, communicating with the patients and making their groups, and also spreading their message to the community. For example, the LHWs in Pakistan are very much effective program, and they are doing many of the, they are involved in WASH, they are involved in many of the maternal and child health, and they can also be increase the community engagement. Next, please. So very important thing is that the public-private partnership. I think as a Pakistan's context, I'm just overviewing where the health professionals should be advocating for the reducing the ITFA for example, the private practitioners in Pakistan, they are very important, because 80% of their OPD, the outpatient consultations, are in the private sector. And more of the NCDs, for almost 80% of the NCDs are being taken care of in OPDs. So they are very important. And so the private practitioners, we need to involve them. And private sector engagement at policy making. For example, the hospitals and for the private universities, private academia, that also needs to be in the policy, because they have the innovative solution, they have more resources, and they can really make a difference. And health professionals need to work on the organizational structures, like PMA, Pakistan Medical Association. Pakistan Medical Association is a very effective forum to reach to the clinicians, private primary healthcare clinicians, or the private establishments. Doctors Con is a big conference which is happening every twice a year, which can really, we can advocate at those forums where this ITFA is how it is impacting the health of the people and how we can save our populations. And the NCD Alliance is a big forum. I think Dr. Tahir will, Sarwar will can elaborate more on it. NCD Alliance, that is also an effective forum. Now the healthcare commissions and the regulatory authorities in health. They have the mandate of controlling, but they don't have the mandate to control the food industry. So these two forums, like health regulatory authorities and the food regulatory authorities, can combine and can join hands with the food industry, and they can make a forum which can be advocate the food safety matters. Next, please. So these are some food practices, features of the new approaches to promote the sustainable food practices. For example, the role of medical professional can be increasing the awareness and knowledge, advocating for the sustainable food options, incorporating the sustainable nutrition into the patient care plans, providing education and training opportunities, and collaborating with the food service providers and stakeholders. But the challenge is that there is a lack of knowledge and awareness, limited availability of the sustainable food options, and there is a lack of patient demand or interest. Like, for example, our PHO is because of the patient like the texture as well as the taste of the Banaspati ghee. So there is less demand and limited training and education opportunities for health professionals. And how we deal with it is increasing the societal support through the awareness campaigns and increasing institutional support through guidelines, information tools, and the financial support. Next, please. There is another scenario where the healthcare professionals is to promote the sustainable diets among the patients by educating them and guiding their diets to reduce the dietary risk factors like ITFA towards sustainability. But they have the challenges that the current role and potential impact of health professionals in driving sustainable food practices are underestimated within the healthcare system as well. So what can we do is like the education, community and clinical health services, community engagement and policy advocacy, governance and the social support. We had talked about the governance as well. In the academia, governance at the we see it in the healthcare perspective. So next, please. And the healthcare professionals can work with the hospital food department to develop and implement the strategies towards the healthier alternatives, and which can also educate patient and staff potential benefits for the health economy as well, society and the environment. So we have the limited resources, challenge is that, and the strategy should be the flexible portion sizes, increased food choices, and additional nutritional support can be given. Next, please. So the WHO replace, as Mr. Zubair has mentioned already, that is a very good action plan. And our policy, our work is also around this. And I think legislation is the place where we need to work more on that because it is still not in Pakistan. Next, please. And so the public health policy and national action plan, these are the where we have the space and we need to work towards that. And health professionals can play a very big role in that. And for example, the Ministry of National Health Services and Regulation has already put in place the NCD's framework, which is a framework and or the way forward, and which is already there, and we can follow that. And national action plan on elimination of the ITFA is already drafted, but still it needs to be approved by the, and Pakistan is going towards the universal health coverage, and universal health coverage, there is a health is not only in the health sector. it needs the multi-sectoral intervention or the intersectoral interventions. Like, for example, the health is outside the healthcare as well, because the food safety, and other science and technology, PSQCA, they are all working towards health. So the intervention, we have Ministry of National Health Services has also drafted few intersectoral interventions which need to be implemented, and ITFA is on priority in that. So next is we advocate for the systemic approach to the food system. Like we need to bring all the stakeholders and we need to work on the system and recognize the importance of governance as one that is already discussed, but the governance in the healthcare is also very, very important, and the implementation of all these policies as well as is important. The need for institutionalized professional practices, like for example, our academia and these professional practices which are nutrition, which is by the nutrition, we need to put focus on that and how they can also affect our policy making, and the support of higher health institutions in planning and implementing strategies, like for example the teaching hospitals, as well as and one thing is, like I was mentioned about the intersectoral interventions, but at the government level, it is very important to bring all these ministries or all the stakeholders together. But what forum? But we need to have the interministerial interministerial forums like CCI. Somebody has mentioned about the CCIs, but interministerial forums which are already existing in the health ministry or the health departments at the provincial level, include the ITFA in that, or the health professionals can be very good advocate on that, or we can make a new body, but the working with the new bodies is difficult, but integration in the already existing system will bring the more fruitful effects. Next, please. Next, please. Yeah, health policy can role in promoting the healthy diets by providing guidance, information, tools, and the financial. I have already discussed it. In addition, initiatives are needed to raise the public awareness of environmental challenges and the indispensable contribution of the health professional towards the food industry. So professionals need to be capacitated to increase their capacity, and they need to speak about the food industry and their hazards, and in their conferences and their wherever they are, they can just give and increase the awareness of the general public as well as the food industry. Next, please. So interdisciplinary collaboration and the future directions can be the interplay between the healthcare and sustainable food systems can be one solution. And the educational and the policy frameworks for the sustainable healthcare, like for example, in the educational and the policy frameworks of the healthcare should be food safety, or the food interaction with the food industry should be included, and knowledge and tools which can be indigenous, which can be contextualized, and they can be empowered. They can empower to the healthcare care to make, or as well as the patients to make their conscious choices. And to achieve the sustainable, it is essential to develop the innovative and adaptable curricula that continuously evolve in line with the scientific advances and societal needs. Here, I would say, like in our curricula, most of these, this generation, the next generation, we start from the beginning, and everything is like, for example, the chemical bonds, this and that. But the practical, like for the example, the label things, this label should be on very, very much in the component of this labeling, as well as these common things which we are discussing. This should be included in the curricula of the students of academia. And in addition, the implementation of robust evaluation tools is very critical to assess the effectiveness of the sustainability education in healthcare, sustainable education in healthcare, and by collecting the ongoing feedback and using evaluation mechanism, institutions can identify the areas for the improvement so that they can refine their educational approaches and achieve the better outcomes. Next, please. So such comprehensive efforts have the potential to educate the generation of the healthcare professionals. They can be capable of leading changes towards the more sustainable and the healthier future. Next, please. So the research on knowledge and practice of health professionals on the food safety and ITFA nutrition, that is the need in Pakistan. And health professionals can put a challenge to food industry through evidence and raising the trends of the rising trends of the particular diseases by communicating with them. Thank you. Next, please. Thank you very much.
Thank you so much, ma'am, for the descriptive presentation. We only have one question from our participants. How can we bridge the gap between the industry and the government sector to address the ITFA problem? Can you elaborate on that? Thank you.
Yeah, as I have said that my topic was the health professionals. So we need to have a forum like I said that there should be the participation of the health professionals at the higher forums like policy making, as well as with the food safe, with the other intersectoral interventions. There should be the health component should be represented very well, and the food industry should be convinced that the health component needs to be in the center. So I think that there should be some forums on that, and academia can play a big role in that. Like, for example, Mr. Allah Rakha has told us, Dr. Allah Rakha has told us that he has highlighted about these in the conferences as well as in the. So we need to work on that, and we at the bigger forums we need to put our word. From the health sector as well as from the food, and there should be more interaction with the food. Like, for example, Dr. Tahira is working with the health ministry as well. So I think there should be close association between the food authorities and the health ministry or the health departments in the provinces. And I'm sure they have the representation also. Thank you.
We have one more question. How can we implement sustainability pillars to every sector?
Yes, I think sustainability is something which needs to be in every sector. And as I have mentioned about few roles and challenges and then the strategies. So we can follow in that. Those strategies for every sector. Like, for example, the food safety sector, we can review the existing condition, and then we can improve. We bring all the stakeholders together, and we can something we can come up with some strategy which can be there. And for the health component, for the ITFA, then as I said that the national action plan is already drafted, but with some it was put in the it was presented last year, but last two years back, but it was not approved. But I think it can be approved later, so we can follow that in health sector. Thank you.
Thank you so much, ma'am, for elaborating on the questions. I would like to invite Dr. Tahira for the closing remarks. Thank you so much, ma'am, please.
Thank you so much, Yahya. I must say that it was a wonderful session, and I want to express my heartfelt gratitude on behalf of STPI to each of our presenters for sharing their valuable insights and expertise. Your contributions have enriched our understanding of the importance of ITFA reduction and the strategies to achieve it regarding healthcare practitioners and academia. It is indispensable to equip our healthcare practitioners and academia people with the tools for the advocacy of healthier dietary choices in the community and institutions they are influencing. Thank you for your dedication, passion, and commitment to improving public health. Your work is crucial in creating a world where healthy food options are accessible to all. I must say thank you to our participants for their engagement and enthusiasm. Your questions and discussions have been invaluable in shaping our collective understanding of this critical issue. Let us continue to work together to create a future free from harmful effects of ITFA. Thank you again, and let us move forward with renewed energy and purpose.
Thank you. Thank you, our esteemed speakers, for taking important time out of their your lives and participating and educating us regarding the matter. Thank you so much. Take care. Salam.